Representative Dent.
Now I bet you can hear me, can't you?
I can hear you. There you are. There you are. Hello.
Right.
How are you?
I'm okay. How are you doing?
I'm not complaining. That's for darn sure. It's good to see your
see.
face. Just
Good to
wanted to see, Krista sent me an email.
Wanda?
Yes.
Just so you know, we are going live right now.
Okay. All right. Thanks.
It's a new experience for me here, doing it on the telephone. So well, I believe it's 10 o'clock, so I'd like to call the DCYF Oversight Board meeting to order this morning on July 7th of 2022. So, Krista, I'd like, would you please call the roll?
I think Representative Dent, since we're in webinar mode and we're promoting board members to panelists, there are some that will not be able to voice that they're present quite yet.
Okay, so do we want to wait a few minutes before we begin?
Yes, I think that'd be best. For board members that are on, you'll be prompted to agree to be a panelist, and then we'll promote you into the meeting. So it does take an action on your behalf.
Okay, so why don't we say 10:05 and see what we have at 10:05?
Yeah, I think that'd be great.
Thank you. Okay, thank you, Krista. It's 10:05, and we will call the DCYF Oversight Board meeting of July 7th, 2022 to order. And Krista, would you please call the roll?
Yes. For board members, as I call your name, please unmute yourself and let me know you're present. Katie Byron. Annie Blackledge. Justice Bobby Bridge.
Present.
Ben DeHaan.
Present.
Co-chair Representative Tom Dent.
Tom Dent's here.
Sydney Forrester. Lonnie Greniger. Ruth Kagi.
Here.
Annie Lee.
Present.
Dr. Diane Levy.
Present.
I see you, Diane.
I said present. Do you not hear me?
Okay, we can't quite hear you, but I see you. We'll count that. Charles Loeffler.
Here.
Lois Martin. Oh, Charles.
And I heard Diane as well. I don't know.
Oh, okay.
Hi,
Apologies,
this
we
is
have
Lois, present.
Back to we're working on over here. Okay. Charles present. Lois Martin.
Present.
Thank you, Lois.
I'm hearing quite an echo, Krista, from you.
Yeah, we're trying to, we've got multiple computers in here we're trying to work through. Co-chair Shronda Slevinoff.
Here.
Representative Tana Sen.
Here.
Senator Judy Warnick.
I'm here.
Senator Claire Wilson.
Present.
And Assistant AG Kristen Lamson.
Present.
Thank you. We have 11 present, which is quorum.
Thank you, Krista. I appreciate that. So at our last meeting, before we abruptly ended the meeting, we had approved the minutes for the prior meeting. So I think that should be adequate to stand for that. And I want to give some kudos out to Nicholas and to Krista at our last meeting there. You know, we were being hacked, and for their quick thinking and recognizing that there was a major issue going on, we were able to stop that meeting and prevent possibly things happening that we didn't want to happen. And I appreciate their hard work and due diligence and being aware of the surroundings that were going on. So thank you both for doing what you did. It was much appreciated that we were able to stop the meeting before something got worse than it was. So, so for everybody on the call today, I will not be able to be here for the whole meeting. I'll be here for just a little bit. I have a previous commitment that has been on my calendar for quite some time. It's very important that I attend today. So I will be here for just a short time. But I wanted to say a few words this morning because I'm very, very concerned about some things that are happening. And I think I want to bring it to the board's attention that we start thinking about some of the things that are going on. And I don't know how much of the rest of the board, how many things you hear from folks in the world out here of foster care. You know, I'm on this and I'm in the legislature for the primary reason because I'm so passionate about foster care. And there's been some challenges in the last 1 to 2 years around foster children, and some bad things have happened, and none of us want to see that. And while I'm very, very well aware of the fact that we don't look into individual cases, I think we do have to watch the individual cases and see if we see a trend. And so I'm asking my fellow members of this oversight board to kind of look at some of the things that have been going on. And if you'd like to have a conversation with me offline, I'd be glad to accommodate you and talk about some of the things that are happening. And because I'm very, very passionate about our children, our foster kids. They're not getting a good start in life, and we need to do everything we can to allow them to have a good start. And so, that being said, when we see these challenges around foster kids being returned home and they shouldn't be, and bad things are happening, and the motel stays and things like that. These issues haven't gone away. At least it's not in my world, because I hear about them almost every day. So I want to, I watch this, I pay attention, I take a lot of notes, and I think it's something that is kind of appropriate with today's topic around prevention. So might be such a thing as think about those things, and if there's good questions around, you could ask around prevention. I think it would be just a good time to do that, because we are charged with oversight. That's the Oversight Board. And I remember when Representative Kagi and I negotiated this oversight committee, and it was very important, very, very important to me and to many others. And what we did to provide oversight over the DCYF, to keep them on track, and not that they're bad, because I tell you, I know a lot of the caseworkers and their hearts are pure and they're working as hard as they can. And I really admire them, and my hat's off to them for what they do. I'm not sure I could do that job. So anyway, I just wanted to say those things that, just to pay attention to what we see, so we can maybe address some of these issues. And I know it's a hot topic across the state. I get phone calls and emails from people all over the state, and I read them and I listen, and I just kind of file it, and I keep paying attention. So I'm just asking my fellow members here to think about doing that, and I would most certainly appreciate that. Again, I apologize for having to leave the meeting early today, but it will be in capable hands with my co-chair, Sharonda. I'm sure it will be a great meeting, and I look forward to seeing all of you someday real soon in person. Okay, thank you very much. And Sharonda, do you have a few remarks?
Thank you, Representative Den. I appreciate your remarks. I will just say that thank you to all of the members that are here today. I want to say thank you to the public that is here today. I know that each one of us have a passion and a care for children, and that we want to see them grow up with their families, in their communities, and those that are most important to them. So looking forward to the conversation with the department, particularly around prevention. How do we keep children at home? How do we keep children in their communities? And hopefully divert some of the harms that we see occur. That being said, I'm going to actually do something technical here, because we, as some of you folks may have noticed, that we are in a bit of a different format. And so this meeting today actually is being run under a Zoom webinar setting instead of the regular Zoom meeting setting. And for those that are observing the meeting in the webinar mode, if you wish to participate in public comment, your Zoom status will be promoted to panelists during your time for public comment, so that you can speak to the board directly. I want to tell you, please bear with us as we work through this new meeting format, and really what it's intended to do is to ensure the effective flow of the meeting while still supporting public engagement. So those are my comments and a little bit of the business at hand. Looking forward to hearing from the department, and I am going to Representative Jett, did you want to introduce Steve and Vicky? And I don't see Steve. Oh, I do see Steve. I do see Steve.
No, you go ahead and introduce them. That's fine.
Okay, thank you. All right, so today's meeting actually is rescheduled meeting from May. And from May 26th, in which we had to cancel the meeting due to some meeting disruptions. This actually is the second meeting in a series of 2 on DCYF's prevention strategies. The first meeting was in March and focused on FFPSA funding and programs. This agenda is actually focused on the agency's prevention strategies across the continuum of care, including how the agency defines its roles in prevention, its theory of change, and how it's measuring its own progress. There's a range of opinions of what people see DCYF's role is in prevention efforts. And after this presentation, during the board discussion, the board will discuss its own expectations around prevention and how the agency is performing based on the agency's presentation. I am now going to introduce Steve Grilly, who is the Assistant Secretary of Prevention and Client Services. Welcome, Steve. It's wonderful to see you. And I'm also going to introduce Dr. Vicki Ybarra, Director of Office of Innovation, Alignment, and Accountability. And also, Vicki, it is wonderful to see you. And I want to thank you both for joining us today. And we are looking forward to all that you have to offer to the public and to the board.
Thank you, Sharonda. It's wonderful to see you as well. And good morning, everyone. We really want to thank you first, the board chairs and the members, for having us back again to talk with you today about prevention services. Dr. Ybarra and I are both very grateful for the opportunity to talk with you again about this important topic. As I noted at the May meeting, successful prevention efforts in Washington will require partnership, collaboration, and commitment among multiple stakeholders. And your interest, influence, and thought contributions are incredibly valuable to moving forward with what we view as really nothing short of a system transformation. As Sharonda mentioned, we did end the May meeting unexpectedly, and while we covered about a third of this information at that time, we're going to go ahead and start from the beginning today for a more cohesive experience. And we figure in this case, repetition is a good thing. There's some themes we really want to drive home. Our goal today is to provide you with a clear understanding of DCYF's vision for prevention, as well as the status of our work in this area. And I'll pause for a moment, Stephanie, in case we want to bring up the slides, because I think at this point we want to be displaying the agenda. There we go. Did we advance to the next? There we go. Okay, great. I'll begin with observations today about prevention as one of DCYF's strategic priorities, vision and leadership in this space, and current initiatives and important considerations for taking the work forward. And then I'll pass to my colleague, Dr. Vicki Ybarra, to walk us through metrics, data, and accountability. Next slide, please. So one of the things we want to address is this question that you see before you: how does DCYF think about prevention as part of its service array? And I'd say there are two primary ways in which DCYF sees prevention as part of the service array. The first is supporting programs and services that keep families strong and together in their own homes and communities whenever possible. And Sharonda and I did not coordinate that. I noticed that you used the same language about keeping families together in their homes and communities. And I am so appreciative of that, because that is a vision that we want to get to. When we do this, we also prevent families from coming into the formal child welfare or juvenile justice systems. The second way in which we see prevention as part of the service array is arresting deeper penetration into our systems and expediting safe exit to community supports. So for those families who do have to come into our system, and there will be some, we want to be able to expedite their exit to appropriate support so they don't have to come back into the system, they recover to strength, and they're able to stay together. Both of these require building community capacity to nurture families before they become involved with our system. This involves engaging with communities about what they need to keep their families strong and recognizing families as experts in what they need to stay strong or to recover to strength. In turn, it involves supporting community-based strategies for prevention of child maltreatment, high-quality services in high-need communities, targeted universalism, so providing services in those highest need areas of the state, community-based alternatives for mandated reporters, and a high-quality service continuum that meets linguistic, cultural, and geographic needs. Next slide, please. DCYF's strategic and racial equity plan is clear about our charge to both prevent harm and get as far upstream as possible in doing that. We want to develop and support a robust service continuum that prevents deeper penetration into our systems and safe exit to community supports for those families that do have formal child welfare or juvenile justice involvement. In partnership with other entities, we also want to develop and support a service continuum that prevents entry into those systems. You may be thinking that I've already said that, and that's true, I have. There's purposeful repetition built in today because we're at a particular moment in history where I think we're recognizing and seeking to address injustices, biases, and inequities, re-examining how society operates, and challenging assumptions and beliefs that undergird some of what we've been doing for a very long time. We're at a point in history where, with a collective will, we can decide that Washington will prioritize human well-being. We can decide that Washington will provide a basic suite of supports for families who need them, without first requiring that they fall into crisis, poverty, addiction, homelessness, compromised states of physical and mental health, and a litany of other conditions that ultimately impact individuals and society negatively. I'll share just a bit of personal information because it comes into my head as I'm saying this, and that is that I chose to leave Philadelphia, about where I made my home, for 20 years, precisely because, I'm sorry, there's something popping up on my screen that I want to get rid of. But I left Philadelphia to come to work for DCYF in Washington because I saw the energy and hope in the agency's charge for prevention and strengthening families. I thought, finally, a jurisdiction that wants to do something different and to get ahead of the problem. And I want to be a part of that. I've also shared with some of you that while I would never trade my relationships with my sons who came to me through foster care and adoption, I also recognize that had their families been able to care for them safely, they might very well have been better off staying with them. I want to be able to get to a place, and DCYF, and I'm sure all of us want to get to a place where we can sustain families and keep them together at home in their own homes and communities. And I just want to keep saying that as we talk today. Next slide, please. So if we want families to thrive and to prevent entry into the child welfare and juvenile justice systems, we need to invest in supportive communities and community-based services, which you'll see here in those two outer ovals on this slide. We see these as part of the DCYF mandate, and our outcome goals listed in our strategic and racial equity plan are all things we can pursue early in communities for identified families, such that abuse, neglect, and other negative outcomes are prevented. Some examples from the plan are that parents and caregivers are supported to meet the needs of children and youth. And one way we can do that is to bolster our mental health and behavioral health systems to provide services and supports for children in their families before they have to get to a point where they need to come into the system because they're at crisis level. Also, family economic security, one of the outcome goals in our strategic and racial equity plan. So concrete goods, job training and placement, childcare, these are all things we can work together to provide to families to prevent them from entering into crisis states. For those families that do require intensive intervention to keep children safe, we also want to provide effective services to strengthen those families, connect them to community supports, and again, expedite safe reunification or other permanency for children. Next slide, please. In September of 2021, Secretary Hunter announced the formation of the Division of Prevention and Client Services, which brought together 3 previously separate divisions: child welfare programs, adolescent programs, and family support programs. In some of his initial communications, the Secretary shared the creation of the new division was intended to take a more integrated approach to preventing children and families from penetrating deeper into our system. So that's one way in which we see prevention. That remains true, and at the same time, we want to get further out than that. We want to prevent families from ever entering the formal child welfare or juvenile justice system. So there's that repetition again. I know you've heard me say that multiple times. We want to learn from communities and families what they need to thrive, and then work with other state agencies, tribes, providers, lived experts, other partners to help communities implement and sustain programs and services such that both adults and children who need supports can get them. And this includes getting those supports in language they speak, attuned to their culture, at the time they need them, and close to where they live. The quote unquote simple goal here is to entirely prevent abuse, neglect, and the trauma of separation from family whenever humanly possible. Highly aspirational, it will require major system shifts, creative funding approaches. DCYF cannot do it alone, and it's long overdue. Thought, by the way, about changing that sentence from our previous presentation, but I thought it still works. I think the ideas in there are really important. I want to point out as well at this point that HB 1661, DCYF's founding legislation, included the creation of OIAA within DCYF to align, integrate, and ensure accountability of state services for children, youth, and their families across state agencies so that there is a seamless, effective prevention and early intervention-based service system, regardless of which state agency is responsible for particular services. And I think that's part of what we need to talk about in an ongoing way. Part of the intent of creating the new division, Prevention and Client Services, was to partner with OIAA and create a center of gravity within the agency for visioning, strategizing, and implementing in the direction of comprehensive child, youth, and family well-being, as distinct from traditional child welfare. It's about significant transformation across an entire system. We're in the process now of organizing the Division of Prevention and Client Services to achieve several broad outcomes, all through a lens of equity and anti-racism. One of those outcomes is the development and support of an integrated service continuum, spanning from primary prevention to intensive services for families already in our system. I'll note here that we recognize that evidence-based practices are not the only type of intervention that families need. We will grow services that are community-based and culturally grounded to meet the needs we learn about from community. Our two largest arrays, combined in-home services and home visiting, both fund EBPs or evidence-based practices and other types of services such as Family Spirit, and we intend to continue in that pathway. Another outcome for the division, another way that we're trying to achieve several broad outcomes is practice enhancement within our agency that emphasizes family voice and empowerment and keeping families together whenever possible. This will be a significant cultural shift, and we are primed to get into that work. We'd also like to achieve system enhancement to coordinate prevention strategies, so that speaks to that work with other agencies and other entities across the state. Quality assurance and continuous quality improvement for practice and services. Adequate internal infrastructure to enable our teams to do great work. So within prevention and client services, integration within and beyond, actually, integration will be key. And so that we can make connections between early learning and families that come to the attention of our child welfare intake, or home visiting and adolescent parents, or any number of other examples. This is much more complex than it sounds, as I'm sure you can imagine. We recently asked a consultant group, for example, for some input from other jurisdictions that had integrated their services, and they came back hands empty. There's nothing out there from other jurisdictions where they have achieved an integrated service continuum. So we're moving through this process of organizing the three previously separate divisions as thoughtfully as possible and creating a structure that integrates and drives us toward our aspirations. And we'll keep you updated on that. Next slide, please. There was interest in the theory of change or a logic model behind prevention, and we don't have these across the broad collection of initiatives that we categorize as prevention. Theories of change or logic models are more appropriate to service lines. What we've laid out here are prevention principles and definitions. And so you can see on the left here of the slide, and I think many of you likely have seen these before, some of the principles that undergird how we want to do the work in prevention. So we'd like this to work all along the DCYF continuum of services, looking at primary, secondary, and tertiary prevention, which are defined in that triangle to the right. Looking at both voluntary and court-involved children, youth, and families. Prevention at multiple levels. Informed by voices of children, youth, and families, as well as data and evidence, really important. Prevention to address disparities and disproportionalities, also extremely important. Viewing early learning as prevention. So childcare, for example, even though it does not fall in what we have titled the Prevention and Client Services Division, childcare is a form of prevention. It enables families to work and to achieve economic stability and hopefully prevent crises from developing. And also endorsing the Children's Bureau's vision for child welfare, which essentially is get out ahead, keep families together whenever possible, and strengthen communities to be able to support families. Next slide, please. At this point, we'd like to talk a little bit about our current progress and looking forward. we'll go to the next slide. You'll see some of the progress in our prevention work that we'd like to highlight. The first is strengthening families locally. And for those of you who are not familiar with this initiative, DCYF receives funding from the Administration for Children, Youth, and Families to work with community members in Bremerton, Port Angeles, Sequim, Spokane, and Ferry Stevens County. In this initiative, DCYF partners with community organizations, government, tribes, schools, families, and volunteers in these service areas to design community-driven solutions to prevent child abuse and strengthen community supports for families. Some of the things that are coming up out of this effort include parenting education, concrete supports, family service navigation, things that communities are bringing forward saying, here's what we need. And then we're able to help support those initiatives in those communities. Home visiting programs, as you likely know, are voluntary family-focused services offered to expectant parents and families with new babies and young children to support physical, social, and emotional health of children. Trained professionals visit families in their homes or community settings to provide information and support related to children's healthy development, support parent-child relationship, and provide information on the importance of early learning and connections to other services and supports. Our recent expansion includes the current RFP for 300 additional home visiting slots and 50 additional tribal slots. And in fiscal year 22, there was an expansion of 150 slots in 23 locales with the highest rates of maltreatment. Our child welfare and early learning navigators. In 2021, the child welfare, these early learning navigators assessed 4,762 child welfare cases for early learning needs. So these are staff that are embedded at DCYF to help navigate the early learning system and refer families where those services are needed. Of the 3,000 referrals by these early learning navigators, 1,500 were to child care, 500 to early childhood education and assistance program or ECAP, 285 to early support for infants and toddlers or ESIT, and the remainder to other early learning services in their communities. So we've really seen in this pilot a good result to the efforts on the part of the early learning navigators, and this is something we'd like to continue. Next slide, please. We've also been in pilot mode on a program that addresses the needs of pregnant and parenting, the SUD needs of pregnant and parenting women. Concerns, so we have often calls to intake where we would need to screen them out because the child's not yet born, so no child present. So this is actually for pregnant women on parenting. What we have started to do, however, is to refer to voluntary service prevention services. So we have successful partnership with community-based care coordination in the counties that are listed here. The family-centered prevention plan designed, and so we are planning for expansion into King County in fiscal year 23. This has been also very successful in identifying families and connecting them to services to address SUD needs. Our plan of safe care is family-centered prevention plan designed to promote safety and well-being of infants with prenatal substance exposure and their birthing parents. So this is the initiative that also includes parenting individuals. A plan of safe care can strengthen protective factors, promote healthy development, and prevent child welfare involvement through connections to parenting education, safety guidance, and wraparound resources and services. The idea here is to provide the support necessary to mitigate risk as they bring their baby home and keep their family together and thriving. So again, that idea that we want to keep families together in their homes and communities whenever possible. A set of criteria does mandate when a family must be reported to Child Protective Services, so we're not losing sight of safety issues. But otherwise, infants with specific substance exposure and no safety concerns are referred to community-based care coordination. We launched, as you can see here, 2 initial sites in June 2021, onboarded a second cohort of 13 birthing hospitals in December of 2021, and we're planning for statewide implementation of the plan of safe care. Next slide, please. Our family reconciliation services, it's a mouthful, or FRS redesign is also underway. This is a service wherein families who are experiencing some type of crisis with their teenagers can call in and be provided with services to help stabilize the family. HB 2873 redefined FRS to include services provided by contracted agencies, which is key because what we would like to do going forward is work with communities and contract with agencies and communities to provide FRS services. The way that this is delivered now is typically by caseworkers who are within the department. I'd like to use that $100,000 proviso in 2022 to design those community-based program models using co-design, and that work is actually underway now. We're hosting sessions with lived experts, system partners, and providers. We'll be doing that. We've done that through October of 2022. Preliminary recommendations are due in December of this year, and then we'll have phased implementation of community-based FRS to begin in summer of 2023. Next slide, please. Motivational interviewing is something that we're also right now in the process of training our staff to be able to implement. Motivational interviewing is a method of communication, the actual language and verbal strategies that reduce resistance and increase functional engagement with clients in a strength-based change process. It teaches the professional how to effectively use their interpersonal skills to facilitate sustainable behavior change. We see MI as critical for workers and service providers in helping prevent deeper penetration of families into our system. We're actually not only training our field operations workers, but our executive management staff as well, from the secretary all the way through the agency, where there are direct contacts with clients. Something that we're proud of, looking forward to in terms of helping us advance our prevention mission, helping us hear the voice of families and the strengths that they bring forward and then build on those. And so we are right now in the process of doing that. In fact, on Monday, the executive team is engaging in its first MI training session. All right, next slide, please. For the 2023 legislative session, prevention is front and center. While DCYF is still finalizing which requests it will take forward, you can see here some of the things we view as priorities. 5718, family reunification, housing case management and housing assistance, family prevention, housing case management to prevent children from going into dependency. Work right now is in pilot status, but we'd like to expand that. Also, we're looking at those front-end services and expanding those as well. So continued expansion of slots in combined in-home services and home visiting. Evidence-based as well as promising practices. So we don't want to restrict just the evidence-based, but also look at other approaches that fit communities that may not have achieved EBP status. We're also targeting substance use disorder treatment and strengthening families locally expansion, so that work that we're doing now directly with communities to hear from them what they need and then supporting those initiatives in the communities. We'd like to expand that model from the communities it's currently in to more of them across the state. Next slide, please. As we think ahead to some of the barriers and challenges to prevention work, one of the things that comes up fairly often, obviously, is funding. Prevention funding that exists is highly prescriptive. One example of that is Family First. As you know, in order for us to draw down matching funds for preventive approaches through Family First, those interventions need to be evidence-based practices, and they have to be rated in the evidence-based practice clearinghouse. And they're also restricted to 3 specific types of services, so mental health, substance abuse, and parenting education. That's just one example of how the prevention funding isn't as flexible as we'd like it to be. Also, prevention budgets tend to be relatively small. Another barrier that we want to work through, and maybe it's actually an opportunity that we have here, is cross-system work. If we want to develop this robust prevention landscape, it's going to take more than just DCYF. I don't think that's news to anyone. One of the things that we want to note here is we're meeting next week, for example, with New Jersey, who has been really successful in creating a system of care across their state And what they have seen is that that correlates to low number of kids in out-of-home care. In fact, at this point, they are the state in the country that has the lowest number of children in out-of-home care. Population-wise, they're comparable to Washington. It is a smaller geographic area, but about the same number of people. And they have some really stressed areas, as you know, in New Jersey. But they have successfully been able to set up services across the state, such as universal home visiting, universal pre-kindergarten, I believe they just committed to, as well as mental and behavioral health services and substance abuse treatment, some of which they control in the Children's Services Agency, so there are some differences in our system. But the idea is they put all this in place, the number of kids that were able to stay home with their families safely increased, and the number of kids who had to be placed out of home decreased significantly. I don't know that there's any research that establishes a causal connection there, but it's certainly a correlation. We hear from other jurisdictions all the time, such as Ohio. The challenge of securing timely and appropriate placements continues to grow, particularly for youth coming into care with significant behavioral health needs, developmental or intellectual disabilities, or as diversion from juvenile correction. And a lot of these things in Washington, we need help from our partners to be able to provide. DCYF is dependent on other systems working to fulfill our prevention charge. And we need to work together with HCA and others on SUD treatment, on mental health and behavioral health, and develop a common agenda and a common pathway for moving forward. And we've engaged in some of those conversations and look forward to that continuing to develop. Access to services also presents some challenges. Prevention services are not currently offered at the scale that we'd like them to be. We also have difficulty meeting the needs of rural communities and ensuring that services are culturally responsive. Right now, we are exploring contracting structures that support rural providers better. So there are a couple of ways that we can do that, especially since they don't get the number of referrals that providers in rural areas do. How can we sustain them in those times when they don't have referrals? We also have a project underway now through the Harvard Government Performance Lab to learn from Black and Native communities about their needs and service preferences. So we're wanting to address that aspect of access to services as well. Next slide, please. I believe that concludes my section. I don't know how you want to handle questions, Shonda, if you want us to just finish, or do you want to pause now?
I think we'll go into Dr. Ybarra's presentation and then have some questions afterwards. Does that work for the board? Okay.
Sharonda, Rep. Dent here. I just have one question because then I have to go.
Okay.
That'll be okay. Thank you. So, Steve, it was an excellent presentation, and you outlined, many avenues where we can improve on, improve prevention services and things like that. But if we put some details of some of these, say like the substance abuse, expanding substance abuse, I mean, do we have any details, things like that, what some of these things would look like? And you don't have to answer the question now. You can send me an email or something, and that would be fine. But I would just like to see kind of where we're going and not just a general outline.
Absolutely. We do have some detail in that area. I know Dr. Ibarra has done some work to identify where across the state, for example, those services are most needed. And so we can certainly send you some information.
Thank you very much. And again, a good presentation. I appreciate it.
Thanks.
Thank you, Steve. Dr. Ybarra?
Thanks, Sharonda. It's great to be with you all this morning. Thanks for having us. Like Steve, DCYF's mandate for prevention is one of the main reasons I'm here at DCYF. It attracted me the opportunity to remain involved in prevention and to help create systems change. My whole career has been devoted to prevention, getting it upstream as far as possible. Many of you know that my initial training was as a home visiting nurse, and I practiced for many years in the Yakima Valley. My role right now in OIAA, I have the opportunity to support prevention across the agency, and this is important work to me. For example, I serve as the lead evaluator of the Strengthen Families Locally initiative that Steve mentioned earlier. So now that you've heard about our vision and plans and services, my job is to share with you how we're measuring these changes. How do we know as leaders of the agency if we've been successful in what we're planning to do, and how do we remain accountable to our public for these changes. Next slide, please. So first I want to focus on one of the questions you brought to us before this presentation related to disparities. We have tremendous opportunity to address disparities through prevention, to reduce disparities in removals through prevention. Many of you are familiar with the charts in this slide. These come from our annual disproportionality in child welfare report. I've lined them up a bit different than the way they're shown in most of our reports, where I've just excerpted the system to show the disproportionalities in line. First, all intakes, then screened in intakes, and then removals. And it's disproportionality in removals that we really want to get to, but we can't do that without considering how families come to us. This statewide data shows us that the vast majority of disproportionalities in placement can be attributed to disproportionalities at intake. If we do the calculations, it's about 80% for Native children and about 90% for Black African American children. That means 80% of the disproportionality in placement for Native children can be attributed to the disproportionality in intakes. That's just the math part of it, but it is quite striking. There is some additional disproportionality at the screen-in decision, but it is very small. For instance, if you look at the top bar on the left side chart, which is disproportionality in intakes for American Indian, Alaska Native children, that very last data point on that slide is 2018, and it shows a disproportionality of 1.8, meaning that American Indian children are included in intakes 80% higher by population than white children. And if we move over to screened in intakes, we see the disproportionality there only 1.89, which means that the intake decision has added only 0.09 to that disproportionality. Most of that disproportionality came in at intake. So this tells us that we have tremendous opportunity to help reduce and eliminate disproportionality in placements by looking at prevention and reducing the need for intake. Next slide. When we look around the state at where placements are happening for Native and Black children, we can identify the areas of the state where most of those children are being placed. I know there's a lot of detail on the right, and it's not necessarily intended that you can read all of those words, but on the top panel for both American Indian, Alaska Native children on the left and Black children on the right, I've identified the top 20 offices for placements. So out of those offices, we are making the top number of placements for American Indian, Alaska Native children and Black children. The top 3 offices by volume for Black child placements are Tacoma, King Southwest, and MLK in King County. And then the top 3 offices for volume for American Indian children are Tacoma, Spokane ICW office, and the Region 4 ICW office. On the bottom panel for each, you see the age distribution of those children going into placement, which reflects the age distribution we see broadly in DCYF for children going into placement, heavily weighted to that under 1 population. So we know a lot about the children going into care. We know that safely reducing the need for intakes and prevention all along the continuum is a tremendous opportunity to reduce disproportionality. Based on this information, the integrated services DP that Steve mentioned earlier will include specific expansions for culturally responsive services in these top communities, in these highest need communities, as well as expanding specific tribal prevention services that the tribes have told us they want to expand statewide. Next slide, please. So here I want to speak specifically to our goal to safely reduce the number of children in out-of-home care by half. We had a question before this presentation on why we chose the in half metric. Next slide, please. This is a big goal for our strategic priority to safely reduce the number of children and youth in out-of-home care by half. Here I have for you a chart that's on our external webpage, on our agency performance page, where we show the number of children in care in two ways. It's most often measured in the agency and in child welfare across the nation as a single point in time. You pick a day of the month, the first day of the month, the last day of the month, and you measure the number of children in care. That is the bottom line graph. You see the trend from 2011 to 2021. The number of children in care has come down quite a bit. The vertical line you see is the creation of DCYF in 2018. And then the top purple trend line is any child in care who experienced out-of-home care during the year, at least one day in out-of-home care, which as expected is quite a bit more than we see at a single point in time. So here in 2018, when the DCYF became a new agency, in that year, over 15,000 children experienced any out-of-home care, and about 9,200 were in care at the end of the year. And we have already seen a substantial reduction in those numbers since we became a new agency. If we look just at the single point in time in 2021, we had about 6,900 children in care. That's a 25% reduction since we became a new agency. So already we've experienced almost half of the goal we have of reducing the number of children in care by half. And these are public information posted on our website. Next slide, please. Why did we pick half? We know that half is a stretch goal, but we also know it's in the realm of possibility by looking at other states. Here I've taken publicly available data, put the rate of foster care per 1,000 child population in 2019, which is the latest data publicly available from this source, and shown you where Washington lies. Washington in this data set had a rate of children in foster care of 6.56 per 1,000 children, just above the mean, but right in sort of that middle group of states. All the way over at the right, you see New Jersey that Steve mentioned earlier. Their rate of placement is substantially lower at 2.3, as is Virginia, Utah, Delaware, Maryland, Louisiana. These are very diverse states who are different from Washington. All states are different, all states are unique. But as Steve said, they are states with their own challenges and that have chosen to line up services in ways that result in reducing the number of children in care. So as with any good goal, we try to look at what's possible, what's in the realm of possibilities, what other units, in this case states, are doing, and choose a goal that is stretched, but at the same time within the realm of possibility. Fine. And in this last slide, I'll just point to where you can find our agency performance page indicators for safely reducing the number of children in care by half, as well as all of our other indicators. We have, as you probably know, an agency performance page where we report on our child outcome goals, which were created the first year of the agency, now on our strategic priorities. Our original attempt at organizing the strategic priorities indicators was by outcome, balancing, and leading indicators. So you'll see a little of each if you look at these now. This has become a little confusing, so I think we're going to refine this in our next update of the priority indicators, but right now you'll see them organized in this way. And with that, I'm happy to answer, either one of us is happy to answer any questions.
Thank you, Dr. Ybarra. Also, we appreciate you. I am going to open it up for the board for questions. And I start seeing the hands raised. Let's start off with Ben.
Good morning. Thank you so much for the presentation. I always enjoy it when I hear you go through your data. It's always very, very interesting. I am curious though, You made a point of saying that foster care dropped off fairly impressively right around the beginning when DCYF was created. Are you thinking that there's an association between the drop in foster care and the creation of the department, or what do you actually make of that?
That's a good question, Ben. So we've not conducted a causal analysis. We do know that the year DCYF was created was also a high point in foster care throughout the nation. So other states experienced a decrease afterwards. We could conduct a causal analysis by comparing the rate of decrease in Washington to other states that didn't have similar policy changes and determine the extent to which it was related to the creation of DCYF. We do know there were initiatives undertaken when we first became DCYF to help support the decrease in foster care, the reorganization of some of our services, an emphasis on the part of DCYF child welfare leadership on foster care placements. So, we would like to think that the creation of the agency contributed to that, but I have to say as a researcher that we haven't done that actual analysis.
Yeah, and it is also true, I think you would agree, that foster care dropped about that same proportion across the country. And we don't really know why that happened, but obviously the effects of the pandemic on mandatory reporting and lots of other things are in the mix. So do you have plans to dig into that further, or resources probably is the best question, to really get a handle on exactly what's happening to kids? Because when there's a 25% drop or even a 50% drop in care, that doesn't necessarily mean that that's a good outcome for all the children who have been removed from the system. So I'm guessing that you have complementary measures that can talk about things like whether or not incidents of hospitalizations or injuries is going up in direct proportion to the drop in foster care. My point is that it isn't just a good thing to exclude them from the system. Some of the states that you reference have very low rates of foster care and very poor outcomes for children, and very low investments in children as well. So particularly the southern states. So anyway, more information about that would be really, really interesting to me anyway, and I assume to other members on the board.
Thanks, Ben. I'll just mention, I can send some information follow-up. I'll just mention here that when the numbers of intakes started going down precipitously at the beginning of the pandemic, we were very concerned about just what you mentioned, the possibility of injuries showing up or deaths showing up. We worked with RDA to create a dashboard that's on our public website that they continue to update, that has us look at emergency rooms and trauma-related injuries that are showing up in emergency rooms and other health-related indicators. We did not see an increase as we feared, but I'll put that link in the chat and I can send you some information as well.
Great, thank you, appreciate it.
Ruth.
Thank you, Sharonda, and thank you very much, Dr. Barretts and Steve. This is really a very informative presentation. I don't know when the department received the funding for strengthening families locally, but I'm very intrigued by that and wondered if you are beginning to see any outcome data about the impact of that investment, if it is actually impacting the referrals in those communities that have received funding.
Yeah, I can speak to that. I have the privilege of serving as the lead evaluator on SFL. The first year, we are seeing a reduction in intakes, but as Ben mentioned, we've seen a reduction in intakes statewide during COVID. So we've not yet been able to attribute that to the work being done in those communities. The first year of the intervention was all planning. It was engagement with the community, bringing the community together, having the community look at data together and determine what intervention services they wanted. So we have just recently started putting new services in those communities just this year. So we can't yet attribute any reduction in intakes to those. We anticipate it's going to take us a few years of actually running the interventions to do that. And in the case of SFL, our theory of change is not just that it's the services that decrease referrals and the need for placements, but also that it's the community engagement and the increased collective efficacy that we see in those communities. So look for more in the future.
Good, thank you. I actually have a second question. It's related to Ben's, and it's whether the factors you look at when placements go down or when return to home, what are the statistics like on returning out of care? I mean, children are returned home and then they end up returning to foster care. Have those numbers been going up?
No, they haven't. So we do monitor as what we think about as a balancing indicator, watching for unintended consequences. We do monitor reentry into care, and we've not yet seen those numbers go up. But there's a fair lag on the reentry measure because we have to let 12 months go by so the child goes into foster care, comes out of foster care. We measure 12 months later, have they reentered care? There's a fair lag. We have not seen an increase, but we continue to monitor it because of the concerns, especially with that big dip in entries right after the beginning of the pandemic.
Great, thank you.
Lois.
Thank you so much, Shavonda. I have a couple of questions for Steve. So I just wanted to find out a little bit more about how much has been implemented of the plan and what's the timeline. And Shavonda, you tell me how you want me to handle this. I actually have I have 3 questions for Steve and 1 for Vicki. So Steve, the first question is how much is the plan has been implemented? What is the timeline? And then I have a couple more questions.
Sure, thanks, Lois. I think some pieces of the plan are already in motion. So some of the things that we looked at today, for example, plan the safe care and some of the pilots with SED services to pregnant individuals, those things are already happening. Strengthening families locally, already happening. These are in pilot phase, and so we would like to take those statewide, and that timeline will be dependent on funding and session cycles. And this is an ongoing effort as we kind of build the prevention continuum out over the next several years, really. And part of what we also need to do as we think about this is get in there with communities to really learn from them about what they need. So if we're looking at a co-design process and a process of really listening in communities and then being able to support what they identify as what they need to support their families, that's going to take us some time. I don't have a specific timeline on, our co-design process and how long that will extend, whether that will be 2025, 2024. But we are starting right now on our current service array, so our combined in-home services, for example, thinking about what areas across the state have the highest need and how we can expand capacity in those areas. That's kind of our short-term, within the next 12 months approach, is to expand capacity and services we already provide now in those highest need areas of the state. Beyond the next year, we're really going to have to work at identifying what the gaps in the continuum are, listening to communities and hearing what they need, thinking about cultural relevance and linguistic relevance, all of these pieces where we need to fill in those gaps, and then build those. So that will take longer.
And Steve, for the pilot projects, how long are they set to last, and how will you measure success?
Great question. Vicki, I might bounce that to you. I don't know if you,
Yeah, happy to do that. So for instance, the Child Welfare Early Learning Navigators that are in place at 10 offices across the state, we're working now to look at service penetration as an outcome measure. So how many more families are hooked up with high quality early learning as a result of that. So that's the outcome measure we'll use there. For Strengthen Families Locally, we'll use reductions in screened in intakes and reductions in foster care placement as the measure, as the outcome measure. But as I mentioned earlier, we won't know that for a few more years. And then the pregnant SUD pilot, we'll be looking at reentry, re-referral as an infant, because many of those screened out referrals that we screen out because there's no child present, but there's a pregnant person who's using, many of those referrals, over half, end up being referred again as substance exposed infants. So we'll be looking at re-referral after birth, and then ultimate placement rates. So those are the kinds of outcome measures we're going to be using for those, and we'll be doing those measurements in the coming months and year.
Okay, thank you very much, Vicki and Steve. I'll let some other people go, but before we do, Steve, and then if there's time, I'll come back around. But for Steve, I wanted to know, and maybe this might be yours, Vicki, how do you plan to gather community input? And then how are you going to report back to the communities how you plan to use the input and have some accountability towards them if you go in a totally different direction than what they tell you is needed?
Yeah, it's a great question.
Yeah,
it's a great question. I can share with you how we've done it, where we've done it. With the tribes, for example, when we were doing planning for FFPSA, we wanted to know what prevention practices the tribes wanted us to prioritize for FFPSA implementation. That took multiple meetings through the ICW process, took a survey of human services, of tribal human service organizations, and from that, we identified their top 4 practices that they wanted to see us include. We were accountable, and we did what we said we would do. We contracted with a Native researcher to conduct an evidentiary review of those 4 practices, and now we are trying to be transparent with the tribes through the ICW process about how we're going to be attempting to fund the expansion of those services and the option for them to provide those services. That's one example. It's statewide. It's a little different with tribes because we do have the ICW forum to work with tribes. We have formal MOUs with tribes. At the local community level in Strengthen Families Locally, we contract with what we call an activator organization that does gathering and engagement so that we can come to the table with community. We document transparently everything that happens in those meetings. It's all on the external website so that when we get to the point of prioritizing services, the community can see clearly how we've gotten to those services. And we, through those activator organizations, we're able to report back what's been done. Those are fairly intensive processes and I think are appropriate for the very highest need communities. I'm not sure we're resourced. We certainly aren't resourced well enough right now to do that with every community around the state. But those are the kind of models we've put in place so far.
Great, thank you, Dr. Yabar. And Lois has a couple more questions, so hopefully we'll be able to circle back to her. Dr. Levy.
Is everybody hearing me okay now? Yes, okay, good. So the first is a comment that I wanted to make about your collateral partnerships. One thing in this work that sometimes gets lost is the fact that the vast majority of children are seeing healthcare providers in that first year of life and on throughout their childhood. And I think sometimes we forget the links with child healthcare providers. And child healthcare providers have done much more screening. We're doing a lot more effective developmental screening to try to get kids into early childhood programs in ESIT. But we also are starting to do more social determinants of health screening. And what we often lack is the link to connect families to appropriate programs right there before we have to make a mandatory report. So I'm just saying that more as a comment. And if you guys have thoughts around how you're planning to kind of draw in the healthcare providers in your planning. So I guess that is actually a question. And then I have one other question too.
I think it's a great observation and one that we want to certainly take into consideration. In some ways, in the plan of safe care, it works that way for adults, right? These adults are in the hospital or birthing, and then they are referred to services right there rather than to our intake. And if we can set up something similar for children who are being screened, which I think we can, we'll just need to work on the infrastructure to do that. I think it's a really great idea. And so we don't have anything right now that is doing that, but we will add that to the list of things that we need to develop further and pursue.
I would just add, Steve, that during the pandemic, at the beginning of the pandemic, when we were so concerned about those intakes that were going down, our family support unit developed in multiple languages a sort of mandated supporter resource list, and I'll find that link and put it in the chat here. So there is this idea of mandated supporters, right? Physicians are mandated reporters, but we also know that they want to support families, so we need to be providing them those resources.
Thanks. And we are at the American Academy of Pediatrics Washington chapter is actually doing a pilot with bringing community health workers into practices, which could also be an area to effectively link. My second question is actually for you, Vicki. When you think about families going into care, and I wonder if you ever do kind of a risk assessment in terms of children being potentially, what is the risk for this child to continue in a biologic family versus being removed, and whether that impacts what your decision making is on intake? Does that make sense? There's just, I was thinking that, every child that gets, every family that gets referred into the system doesn't necessarily, I mean, they're all very different. And there has to be some families that have higher risk based on maybe past history of domestic violence, substance use. And I wonder if you just strategize with your interventions based on some of the risk assessment at intake.
That's a great question. I think some of it's practice related, so I'll speak to the data pieces. The primary tool we use in that front end piece, that front end of child welfare to determine the risk to the child is safety, right? Statutorily, we are called to intervene if there are safety risks to the child. And so our caseworkers spend a lot of time looking at safety in different ways and determining the extent to which the child can be kept safe in the current environment, and what mitigating or additional safety measures can be put in place with relatives or others to help keep the child safe in the current environment. And then children are removed if those safety threats can't be mitigated. We do not have a front end family needs assessment because the system is focused on safety and risk. That is something with FSPSA that we'd like to change, and we have some of our researchers looking right now at those assessments along with leaders in the field to consider whether we need an additional type of assessment up front. We know that our caseworkers already have a lot of paperwork to fill out, so we're not looking at burdening them with additional paperwork, but trying to find a way to leverage the information that's currently being collected in a way that could get us closer to a family needs assessment.
Thank you, Dr. Levy and Dr. Ybarra. Looks like Representative Sin has a question.
Thank you, Sharonda. Thanks, Steve and Dr. Ybarra for this presentation. This is going to be kind of a rambling question, so I apologize. So starting off with kind of a comment, I just want to highlight that this past legislative session, we did specifically call out Grays Harbor for safe care programming and for increased SUD treatment, or not increased, new SUD treatment for pregnant teen parents. And so I wanted to make sure that that was highlighted, and also which highlights the community connections, or cross-agency connections, Steve, that you referred to, that I just wanted to underscore, because while it's critical in prevention that DCYF work with the HCA, work with behavioral health, on the other end too, Developmental Disabilities Administration, DSHS, HCA, all of that is so integral. And I think that sometimes we and the community forgets that you are directing people to services, but you're not necessarily providing them all, and that they have to be there in order for your families to access them. So I just wanted to kind of underscore that, because I think DCYF gets a lot of heat, and sometimes you're relying on cross agency partners. So I did just want to underscore that and feel free to comment on that, which leads me to the actual question, which is you discussed a lot the importance and the focus on Black and Native Americans in particular. And I just wanted to see if you could talk a little bit about where rural communities fit in terms of unique challenges or special focus that you may or may not be doing, and what are some challenges or barriers that might be important for the board to know.
I'll start by thanking the representative Sen for that underscore, because I think it is critical to think about how we can all partner together to provide families with what they need. Sometimes, we get in this place where it feels a bit like a zero-sum game, we don't have enough resources to spread across the agencies to provide everything that families need, and then we're kind of pointing at each other saying, no, that's your responsibility, or it's your responsibility. And really what we should be doing is thinking about what we all want to achieve for families and then figuring out how to move that forward together. So I really appreciate your recognition of the fact that we do depend on our agency partners to serve families well. I think for rural communities, the first thing that comes to mind for me is really the ability to provide the service at all. So sometimes we have providers that are sole proprietors. They might be one person. They might get I don't know, let's say 6 referrals in 6 months because it's a rural area and there aren't as many. It's not like being in a city where you could get a number of referrals. And if they needed to add capacity, they can't do that unless they have the number of referrals to support it. To, for example, add another therapist out in Okanagan. One of the things we do now is fee for service. So they only get paid if they see someone. But if they're not getting enough referrals, they don't get paid and they can't keep their capacity up. So we're trying to think about different ways of contracting in rural areas, such as slot payments, where we pay people to have openings so that if they can sustain staff, when there is a need for a service to be provided, they have people there already on staff, trained, ready to go. It will require a different way of funding it. And it's one of the biggest challenges that I think of right now when I think of rural communities. Vicki, there may be others that occur to you, and I'll also give you an opportunity here.
Yeah, I would certainly agree with what Steve said. I think the other two opportunities we see are telehealth and the opportunity to provide some of those therapeutic services via distance, right? We did that for a while in COVID, and I think we could learn a lot from that. We know that in many cases, our clients like that, our service providers like it, and it may be a way to, in addition to other ways, it may be a way to help increase access to services in those rural communities. I will say too that our tribes are often located in rural communities, and we have heard anecdotally that there are some tribes around the state that are interested in expanding services or becoming certified to expand services in a way that would allow them to serve their own communities, but also serve the surrounding communities. So I think that there's opportunity to leverage that. That would be a big bang for our buck if we could contract with tribal community partners to increase service penetration to our Native American clients, but also potentially to the rest of the community too.
And Senator Warnick.
Thank you, Shonda, and great presentation. I have questions for both of you. I want to follow up on what Rep. Dent said about more details. Steve, you started out by saying our goal is to keep families together, and that's why I've participated in this forum for so long. And because I'm as passionate as Rep. Dent is about keeping families together. But more details about our substance use treatment, especially when there's families involved, would be helpful, more details. And then you also said prevention budgets need to increase, and I wholeheartedly agree with that. And so if you could maybe give us, and you don't have to do it now, but give us a little more detail about what would be helpful for prevention. But I know when you treat a parent or you treat one family member, you treat the whole family, whether it's mental health or SUDs. So more details would be very helpful. And then kind of along that line, Vicki, you said something about when children are returned and then to the families, and then looking at re-entry to care. We don't know that for a year. Can you clarify what you were talking about with the 12-month program there, or 12 months return? I'd sure like to know what that was all about.
Yeah, that is, I was speaking, thank you, Senator, for the question. I was speaking specifically to how we measure it. So how statistically we construct that measure, and it's a measure that ACF uses, the Children's Bureau uses. We have to report it to the feds, so we monitor it pretty closely. But the standard way the metric is constructed is that we take a cohort of children. We look at a cohort of children who exited care during a given time period, and then we look at the data for a year after that, a full 12 months after that, to come up with a rate of reentry. And that's what we monitor, is a rate of child reentry into care.
Okay.
I'm sorry if
Okay.
that was confusing.
I was hoping that you weren't just, they go out of care and then they're just out of care totally. I was hoping that was not what you were telling us for 12 months, that we are actually monitoring them.
We measure whether they show up in our data again. After trial return home, we do not actively, families don't want us in their life after they get their children back. We do not have statutory authority to be in their lives after they're reunified. And we provide services and try to make sure they're hooked up with supportive services that are needed, as Steve said in some of his efforts, but we're not actively, we're looking in the data to see if they show up again in our data.
Okay, because I've, unfortunately heard of children that were returned too soon. And I think Rep. Dent brought that up as well, but that's kind of what I had concerns about. So, okay, thank you.
Okay, Representative Sen, your hand's up again. I just want to make sure you didn't take it down or it needs to come up.
I just have a follow-up to Vicki's comment there.
Okay.
If I might. Can you just clarify, I think to Senator Warnock's question and your answer about families not wanting you engaged after their child is returned home. You said the trial return home period. So can you just expand on that when a child is returned, it's not their return and then goodbye. There's a 6-month trial return process. If you could just talk about that for a little bit, I think that would be helpful to dispel what it sounds like you just said, that we don't, once they're returned, we don't monitor them at all.
Steve, can you speak to that?
Sure. So the trial return home period is a 6-month period where, just like it sounds, the child is placed back in the home, and this is after a period of time where the family's been receiving services, and it's determined by the service team, the case manager, supervisor, and the court that the child can return home. We continue to monitor that case or that family for 6 months. So we'll be doing health and safety visits, the caseworkers visiting the home. We're making sure that services are in place. At the end of the 6 months, if all are in agreement in court, the case should be dismissed. That case has been dismissed, and we no longer visit the home and provide health and safety visits. Because as Vicki noted, families are ready to carry on with their lives. We do make every attempt to connect them with services so that once that trial return service period is over, they're integrated into their communities in ways that will support them from having to return back into the system. Does that help at all? There is a period of transition.
Lois.
Thank you very much, Sharonda. And so I have a question about that. the removals too, and just wanted to find out of the placements. I know you keep track of how many are returned to families within a 30 or a 60-day period, and that's something you can follow up with Krista. But I am curious about the returns. And then I want to know what the department is doing to ensure that implicit bias is not, is minimized in these removals, since the largest number seem to be children of color. And then I have my other questions.
Yeah, if there's a data question in there, Lois, I'm happy to answer it. I'm sorry, I didn't hear one. It sounded more related to practice.
Oh, I'm sorry. It is more related to practice. It might be more for Steve, Vicki. And I'm obviously at the center. I know you hear the little one from the background, so should settle down. We're getting closer to that. So my question was, you know, the first one is data. So it's yours, Vicki. And that's of the placements, how many are returned within a 30 or 60-day period. That's one you can get back to Krista or Nicholas later, because I know you don't know that off the top of your head. And then for Stephen, my question is, what is the department doing to ensure that implicit bias is minimized in these removals? And then also for practice, what is the department doing to reach out to foster parents for input into this process?
So Lois, I may need a little more clarification on the second part of that question about reaching out to foster parents for input. I think, and I almost wish our Assistant Secretary of Field Operations were here to help talk about the implicit bias in intake and removal, because that sits in her division. But we have engaged in a number of discussions in the department about how to get at some of that. And so for some of us right now, including Natalie, who's our Assistant Secretary of Field Operations, are involved in a race equity convening with actually KC Family Programs to really look at and develop plans for our agency about how we're going to get at some of the things that you mentioned. So not just intake, but also across the agency. Where is it that we're seeing bias, implicit bias, and trying to root that out and address that in the agency. So we're engaged in a process now that is bringing us together, some of the leadership in the agency, to develop an actual concrete plan that says we're going to work on this in this way. That's not completed because we're still doing that with Casey and a number of other jurisdictions across the country, but it is an effort that we're engaged in now. I will refer also back to Vicki's observation, and this is not to say there is no implicit bias at intake, but it sounds, Vicki, correct me if I'm wrong, as if a lot of that bias happens at the referral, and where there's not, where the intake actually is, we're not seeing a lot of disproportionality added at that actual removal decision. I want to make sure I heard that clearly.
Yeah, you heard that correctly, Steve. We can't actually, in the data from a research perspective, looking at quantitative data, we can't actually rule out that bias isn't happening, but we can't identify either where it is. We can rule out other things. What I can tell you is that the intake decision is not adding significantly to the disproportionality in placement that we see. Our QI process also, our QI unit also does thorough reviews that are publicly posted on the intake process, looking at the process itself, how it's done, how those decisions are made, is there internal consistency with how the decisions are made, and then with every review, they create a performance improvement plan. Our intake process, our screen-in process, is, I feel really confident in it. I don't know those people, but I would expect that they are probably experts in what they're doing, because they're not adding substantially to a disproportionality, and the QI reviews of the cases come back really positive. So I'm not concerned about our screening process. I think we need to be vigilant and continue to monitor it, because that could change. But I don't think that's where we have bias leaking in. We also did a recent report. One of our researchers did a report on placements of Native and Black children to look at potential safety threat sources. So looked at that safety assessment to see Are there things in the safety assessment that might indicate that why these children are being placed at higher risk? It's a technical report, but also those kinds of, we're trying to support the agency's efforts to eliminate bias by looking closer at the data and providing as much information as we can.
Vicki, I think also that speaks to the work that Doug's doing around the assessments, looking at them across the agency and trying to do exactly what you just mentioned. So where those tools that we're using actually potentially contribute to bias, to really address that as well. Lois, you had another question about foster parent involvement, and I'm not sure I understood it entirely.
No, no problem. So for the foster parent piece, you know, I think, oh gosh, I apologize. I think it was Senator Warnick who mentioned about some children being returned earlier, resulting in really tragic outcomes for the children and the families. And so, you know, if you think about looking at a timeline for when a child should be returned and that type of thing, I'm just wondering what input, or if DCYF is doing any type or receiving any type of input from foster parents on that piece of the process. I know that the answer could easily be, well, that's up to the courts to decide, but it seems like there should be something in place where there might be warning signs or something that foster parents see that may trigger a little bit more consideration before children are returned. So I'm just wondering, like, what role does the department play with foster parents in those cases?
Sure, I think it's in some ways integrated into the health and safety visits that caseworkers do with foster parents. They are expected to be gathering information from foster parents about their observations on how the child is behaving, what types of things they might be observing. Some foster parents also facilitate visits between parents and children, and so they can bring information around that. There are opportunities for foster parents to interact with caseworkers and pass on any information they have, and caseworkers should be actively seeking that. It's not typical that foster parents are parties in court, and so they're not often speaking with the judge, but they do have opportunities to provide information along the way. Does that help?
All right, thank you, Steve. It does. And then my final question is, I know you had talked about, you know, the early learning field and the piece it plays on and reducing referrals and that type of thing. So I'm just curious about what your plan is. How do you plan to graft early learning into this prevention strategy? I know early learning was part of WA Kids, and it worked well through some sites that might have received subsidy from the state or ECAP sites, but overall it did not, you know, kind of trickle into private centers or homes. So, you know, we could have that same issue again unless this is done well. So what is your plan to add early learning into this prevention strategy?
It's a great question, and the answer is fairly easy and straightforward, and that is we don't have a developed plan yet. I'm still talking with the Assistant Secretary Nicole Rose around that. What we're trying to do is sort of phase this. We know we have some immediate needs in developing the service continuum in the next 12 months, and then we have to develop further from there on how we create some of those connections. So we don't have anything right now concrete. I'm looking at Vicki because I see you came off mute, but there are some things we're doing. For example, those child welfare early learning navigators that are in existence now, small scale at the moment, but we'd like to take that up in scale, are connecting our child welfare families to early learning resources. And we shared some of those numbers earlier today. We'd like to see that kind of effort build, and so that's the kind of thing we'd be looking at as we go forward and making those connections. Vicki, did you have other thoughts?
I was just going to comment on the child welfare early learning navigators and the importance of that work. The research shows us clearly that there are many ways that high quality early learning helps support families, build protective factors and support development of children, as you know, Lois. And those are resources that we want our children and families to have access to. They're voluntary resources, of course, but we find that when we have a navigator in an office who understands both the child welfare system and the early learning system, and they do outreach to those families with young children, and take the time to assess where those children are, what their needs might be, and to make warm connections to local community resources, we find that many parents, not all, but many parents are interested, and we need to beef that up. It's a very successful intervention.
All right. And Ruth, sorry, I keep calling you representative.
Thank you. Well, it's very much along the same lines on early learning. And I was pleased to see that early learning is identified as a prevention service. And as Vicki mentioned, research is very clear that it by itself can reduce abuse and neglect. And I'm wondering if families involved in child welfare, their case closes 6 months after the child is returned home, do they continue to have eligibility for childcare and for the counseling they need? I mean, do services that really support their well-being continue after that case is closed?
They do. So childcare does continue for a period of time after the case closure, and most of the services are provided through or funded through Medicaid that they're connected to, and that should continue with them beyond case closure. So there are some mechanisms for making sure that they're connected to those services even after the case closes.
So you said they continue for a period of time. Is there a set period of time for childcare to continue, or can it continue until that child goes to school?
Vicki, I might need to check with you on this one. I believe there's a year after that it's funded.
Yeah, so I think we can check with Nicole and get back to you on that, but I believe there's work being done to roll up the child welfare and working connections into one so that families can continue eligibility once the child is found eligible. Once the family is found eligible, the child has eligibility for the full 12 months. But we can check with Nicole and get back to you on that. Most of these families are very low income, so they would continue to be eligible for working connections just under the income requirements. It's the exception from the work requirements that's needed in order for them to continue eligibility also.
Thank you for that. And looks like Annie has a question. And also, I just want to acknowledge Lisa has a question in the public, and we don't take questions from the public. The questions are just for the board at this time. But I want to encourage you, Lisa, that if you have a question for DCYF, that you reach out to them. And I didn't want you to think I was ignoring you. So just needed to throw that out there. Annie Lee.
Thank you, Sharonda, and thank you both, Vicki and Steve. The presentation was really, really helpful and excellent. I have a question that might be the subject of another meeting or a future meeting, but I wonder if there's any aspect that you can speak to today about sort of prevention strategies for our more deeper end young people in our juvenile legal system at JR and so forth. I know there's references in the strategic plan around leveraging some of the activity in terms of diversion at the county level. And we have a really excellent state law that really creates an opportunity for almost all juvenile court referrals to get diverted. Practically all of them are eligible for diversion. And then of course there's on the back end side in terms of, and I don't know if you view this as prevention, but the metrics and ideas around trying to prevent recidivism as young people are exiting. I think, and again, I may be out of line, and this might be a subject of another meeting.
I think it's an excellent question, Annie. Thank you. I'll just say that from a data and metrics point of view, leadership team and the assistant secretary for JR have worked to develop what we think are metrics for successfully launching youth, and we believe if youth and young people are successfully launched, that will help prevent them from coming back into the system. and more than that, help them be successful with their post-JR life. And those indicators include things like access to behavioral health, access to housing, which is, as you know, is a huge barrier for many of our youth and young people who leave our system, and supportive community resources. So we are looking at developing data points to help us beef those pieces up. At the same time, our Assistant Secretary for JR, Felice Upton, is absolutely committed to strengthening our exiting system so that we can provide more resources to young people who are leaving our system. We're excited about the development of an integrated services array that you'll see in a DP, so that youth in JR who are exiting will have access to many more resources than they have now. So, absolutely appropriate question.
And just to follow up, just on the diversion side, so even preventing entry into juvenile legal system at the front end, is there work that DCYF is embarked on in that?
Yeah, I think that's a question we'll probably have to ask Felice and get back to you on, Annie. I'm not aware of it. I don't think Steve is either, but we can certainly ask.
Any other questions from the board? All right, well, I have one. Wanted to create space there. My question is, in recognizing the needs of families, particularly in the areas that the department has identified, the Tacoma King and MLK, have you guys started to look at exactly what type of approaches or investments? What exactly does that mean for those communities, recognizing the high number of families of color that are entering into care?
Thanks, Sharonda. Great question. So we've done a couple of things since we identified the data. We worked this last year with one of our Government Performance Lab fellows on interviewing service providers in those communities who are serving those families, so that we could identify what barriers they may have to providing services. So we've got the product as a result of that tells us what service providers are saying. What are your barriers to contracting with the department to provide services? What are the needs that you see mostly in those communities? So we have that information now, and we'll be pivoting this year to try to beef up those services. As I said, you'll see those included in the DP and the Integrated Services DP. In addition, we're talking with a private funder who I won't name right now about what we could be doing to get down to the neighborhood level in those communities. Could we be engaging service providers or activator organizations to do more to identify the needs and meet the needs in particular neighborhoods within those communities?
Thank you. Any last questions from the board? All right, that awkward silence place. All right, well, I'm going to first of all just say thank you very much, Stephen and Dr. Ybarra, for coming today. We really appreciate how thorough and thoughtful your presentation was. And as we're getting applaud from the board, I also want to just applaud the efforts of the department of continuing to recognize and understand families and pivot as necessary. So very excited about the prevention, the opportunities that are provided to enhance services and supports for families. And so we will look forward to future meetings of learning what the exciting work you guys are doing and how we as a board can support that or challenge you in ways to improve. So thank you so much for joining us today. The next part of our agenda actually is a break, and it was scheduled at 11:50, but who doesn't want 7 more minutes to their break? So you're about to get that. So we will return back at 12:15, I believe, or excuse me, 12:05, excuse me. We'll return back at 12:05, and we were going to go into public comment. I want to encourage the public to, if I have it right, and maybe Crystal, I'll turn it over to you just to give whatever directions for those that are interested in providing public comment. Oh, looks like you got a slide. Okay. All right, so looks like you emailed Nicholas if you are interested in public comment, and we will resume back at 12:05 for that. Great. All right, we'll come back together. And I'm gonna do public comment. Currently, I have 3 folks signed up for public comment. And I'd like to read the public comment statement, which states that the DCYF Oversight Board is governed by state law. Per state law, the Oversight Board's authority includes monitoring DCYF's achievement of 8 outcomes measures listed in the DCYF founding legislation, monitoring DCYF's compliance with applicable laws and policies pertaining to early learning, juvenile rehabilitation, juvenile justice, and children and family services, general oversight of DCYF's performance and policies, and provided advice and input to DCYF, the legislator, and the governor. The Oversight Board does not have authority to inquire into, direct, or change DCYF decisions in individual cases. And for those wishing to provide public comment to the board, we would like to remind you that the board is subject to the Open Public Meetings Act, which means that our meetings are open to the public and anyone can attend as an observer. Our meetings are recorded and posted on the Oversight Board's website and will be broadcast on TVW. We wish to inform everyone in attendance of this fact as an act of respect and support to individuals who may have a sensitive story they wish to share or wish to express individual case details in this setting. The Oversight Board may use any information brought to the board's attention as it carries out its role of general oversight and monitoring on DCYF. So we're going to open up for public comment. I also want to just let folks know that we did receive written public comment during our last board meeting, Tuesday, May 24th. That has been shared with the board members. And also we received 2 more public comments written, and those 2 were shared with the board. So I want to thank those that took the time to write. We appreciate you, and I'm going to turn it over for the first public comment. I want to remind folks we don't have a lot of folks, so maybe 2 to 4 minutes time maximum for your comment. And first up, we have Shayna Richard.
Can you hear me?
Yes.
Okay. Dear Washington State Department of Children, Youth, and Families Oversight Board committee members, I'm a founding member of an organization called Light the Way Missing Persons Advocacy Project. Our team members have been investigating and advocating for Oakley Carlson, the 5-year-old missing child from Oakville, Washington, since December 2021. We are working with Oakley's loving and courageous foster parents, Jamie Jo and Eric Hiles, to find answers for Oakley, whose last known credible sighting was on February 10th, 2021. Sadly, she was not reported missing until 10 months later. Since February 10th, 2022, Light the Way has organized a weekly phone call and email campaign of Oakley's online supporters to contact Governor Inslee's office to ask what he conduct an outside agency review of her case and express our concerns about what happened to her. In the months that we have contacted Governor Inslee, we have received no response to our emails and phone calls. His office has been contacted several times by reporters and he has refused to comment. A national foster care advocate that works with our organization had a meeting with Governor Inslee's staff in an attempt to advocate for Oakley and was specifically told that Jamie Jo Hiles was not allowed to attend. This left the Hiles upset and hurt that they were not allowed to speak on behalf of their daughter. At a press conference this spring, Governor Inslee was asked about Oakley Carlson's case, and he finally had no choice but to respond. What he failed to say in his answer was Oakley Carlson's name. When an individual goes missing, their loved one's greatest fear is that people will forget them. And in front of the state of Washington, Governor Inslee did just that by failing to say Oakley Carlson's name. A little over a week ago, Ross Hunter, the secretary of Washington DCYF, was interviewed for a local news program about Oakley's case. The news reporter asked, who is advocating for Oakley? Who is answering questions about how Oakley was protected? Mr. Hunter responded with a long, awkward pause and then failed to answer the question. So I ask all of you to think for a moment and reflect. If the secretary of Washington DCYF is not advocating for Oakley, then who is? Oakley was last known to be with her bio parents, Jordan Bowers and Andrew Carlson, who refused to give any information on her whereabouts and what happened to her. Bowers and Carlson are currently incarcerated and serving time in a case unrelated to Oakley. In March, Carlson pleaded guilty to 2 counts of endangerment with a controlled substance for exposing Oakley's 6-year-old sister and 2-year-old brother to methamphetamine. The judge stated during the sentencing hearing, "It's a father's job to protect their children. You certainly failed in that, Mr. Carlson." He was sentenced to the maximum 12 months in jail. In April, Bowers took the Alford plea, which allowed her to take advantage of a plea deal without admitting guilt to the 2 counts of child endangerment with a controlled substance. She was sentenced to 20 months in prison. Oakley spent from age 7 months to almost 3 years old in foster care with her loving foster parents, Jamie Jo and Eric Hiles. They provided a safe and happy home where Oakley thrived. The Hiles planned on adopting Oakley until one day in November 2019, when they were abruptly told that Oakley was being reunified with her parents. The Hiles immediately voiced their concerns as there were incidents of domestic violence between Bowers and Carlson that Oakley had witnessed. During the 3 weeks from when the Hiles were notified Oakley was returning to Bowers and Carlson's care to when she left on November 29th, 2019, the Hiles repeatedly voiced their concerns to Washington DCYF, but it fell on deaf ears. Years later, the Hiles continued to voice their same concerns and were the ones to call in 2021 when there were reports of bruises and a black eye, and again when there was a suspicious fire at Bowers and Carlson's residence. They feel as though their concerns were not taken seriously and were simply ignored. They are seeking answers for Oakley. According to police reports and news articles, while in Bowers and Carlson's care, Oakley was starved, beaten with a belt, and locked in a cabinet under the stairs as a form of punishment for bad behavior. This is child abuse. How did Washington DCYF miss this? Why didn't Oakley's rights to safety and her best interest outweigh her parents' rights? This is a big question Washington DCYF needs to ask themselves when solely focusing on reunification. Oakley Carlson was taken from a safe and loving foster home and left in a home with child abuse, drug use, and what ultimately ended in a devastating story of a missing child. If Washington DCYF focused less on meeting reunification statistics and more on the best interest of children, Oakley might be here right now. I imagine that she might be enjoying summer ice cream at the park and going on summer vacation to the beach with Jamie Jo and Eric, the 2 parents who love her most in the world. Please help us in advocating for immediate review from an outside agency of Oakley Carlson's Washington DCYF. Show your support by pitching in, as Governor Inslee stated, and doing what is morally right. Thank you, Shana Richard.
Thank you, Ms. Richard. We appreciate you coming to the board today and certainly your commitment to Oakley. I am going to go to the next public comment, and the person's name is Tate, but I don't have a last name.
Hi, can you hear me?
Yes, I can.
Hi, thank you. Thank you for allowing me to speak today. I'm here also on behalf of Light the Way Missing Persons Advocacy Project. I'm here with hopes that your oversight board will call for an immediate review of Oakley Carlson's case by an outside source. I think you all probably know who Oakley is by now, but I'm going to go ahead and read what I have here. She's a 5-year-old girl from Oakville, Washington. Her last known credible sighting was on February 10th, 2021, which is almost an entire year and a half ago now. Sadly, Oakley wasn't reported missing until 10 months later on December 6, 2021. Prior to that time, there had been a fire at her house and the school principal became concerned about her safety. Her bio parents, Jordan Bowers and Andrew Carlson, refused to give any information on Oakley's whereabouts or what happened to her. Bowers and Carlson each at one time faced one count of second-degree abandonment of a dependent child for allegedly neglecting to give their 6-year-old daughter a prescribed medication, and 2 counts of endangerment with a controlled substance for allegedly exposing their 6-year-old daughter and 2-year-old son to methamphetamine. Later, Carlson pleaded guilty to the 2 counts of endangerment and was sentenced. And Bowers' trial took place in April, and she was sentenced to 20 months in prison. Oakley spent from age 7 months to almost 3 years in foster care with her loving parents, Jamie, Joe, and Eric Hiles. They provided a safe and happy home where Oakley thrived. The Hiles, along with community members, raised concerns about her care to the Washington State Department of Children, Youth, and Families many times. They feel as though their concerns weren't taken seriously and were simply ignored. They're seeking answers for Oakley, and so are we. I think this brings forward another matter. It's not always best to reunite families. I think that it should be on a case-by-case basis. The Hiles were the only parents that Oakley knew for almost 3 years before being traumatically removed from their home and put into a home with people who she didn't know, people who didn't love or care for her. I think it's important to take note that this isn't the first time such grave mistakes have been made, and I think that it's time to make changes. I'm asking you today to please move forward with an immediate review of Oakley's case and take the first step to making changes for the better, not for myself or anyone else here, but for the children. Thank you.
Thank you so much, Tate. And once again, I want to thank folks for their commitment to Oakley and appreciate you coming to the board and sharing. I have one more person for public comment. It looks like Lori Lippold.
Hi, thank you very much. Hello, everybody. I'm Lori Lippold. I'm the Public Policy Director at Partners for Our Children. And again, I appreciate the work you all are doing and the opportunity to just comment very briefly. I will say I recognize that I am a broken record and I can't help it. So apologies. But I do feel like since we are just still just a few months from the end of the last legislative session, that I might, and you might be willing to listen, to talk about a couple of things that passed this past session that might be worth monitoring in terms of implementation. And one is 1747, the bill that has to do with placement with kinship caregivers, et cetera. That one has gone into effect as of June 9th, so it's very recent. And given the opening that is always given so wonderfully at this meeting about the role of the Oversight Board monitoring implementation always comes up. So that one would be very current. From 2021, House Bill 1227 was passed, and that goes into effect in 23. So there's still an opportunity to really be following and monitoring what happens with implementation of 1227. And obviously there are many, many, many more things, budget provisos, as well as legislation. But I did also want to mention something that is kind of new and not new, but being brought up again from the past that I would strongly recommend looking closely at and paying attention to. And that is what's happening with the, I guess, going statewide with the network administrator. That legislation passed way back in 2012 and did not go into effect immediately. It was House Bill 2264. There's been at least one subsequent change to that in terms of some timelines, but there is a process underway right now of actually seeing how that could look going statewide. And I would just flag that for you as well. So those are a few that might be worthwhile to be paying attention to at this point. And then related to the conversation you had previously, and I apologize, I came in late, so I missed that, and I'm really glad this is being recorded. But I have always been curious about the degree to which families, once there has been that trial return home, are being connected to services that are not being provided through DCYF. And I don't know if there's a way to look at that, but I just recall from a number of years ago, there being kind of this notion that the families could get referred to DCYF or Children's Administration at that point, services, but things outside of that realm or purview were not necessarily being brought into that situation. So I think particularly given some of the comments that were made previously from the folks from DCYF about working with partner agencies, et cetera, that there are so many other things that are being offered in the community, so many services, not all communities, obviously, but services that are not part of the DCYF system, whether they're through a different state agency or funded through a state agency or private or whatever. I just would really hope that there is that awareness on the part of people who are working with the families at the trial return home and beyond, that full array is being made available. So anyway, thank you very much.
Thank you, Lori. And as always, you always give us some things to think about. So thank you for sharing with us today. We are going to, and we're going to close public comment. Nicholas, I don't think that there's anyone else that's come forward. Want to thank the public for coming and sharing with us today your concerns in areas that need further exploration. So thank you for that. The next agenda item that we have is to go into an actual discussion about the presentation that we heard today from DCYF. I want to take some time to just kind of reflect on what we heard and, talk about maybe some gaps and opportunities and areas for future follow-up. So I'm just going to open up the floor. What did you hear? What intrigued you? I know that we had already some questions from the board, but how do we want to proceed moving forward? So just open up the floor for discussion. Dr. Levy.
Well, first of all, I just want to say I really appreciate the last two meetings and the attention that we're paying to prevention. This is sort of a mantra of mine to talk about moving upstream. So it feels really good to hear about concrete efforts to bring the prevention early in an individual's life. So I really appreciate that we've had this focus on prevention, and I don't want us to lose it. I think it's something that we need to check into on a routine basis. And I specifically think we need to know which programs seem to be working. So for example, Vicki had identified that the navigators who are working between Children's Administration and early learning centers or early learning programs is actually being a very effective program. So I think it really helps us to see the numbers and to see which programs are seeing outcomes. That can be incredibly difficult in prevention work because sometimes the outcomes are long. And for example, in home visiting, if you look at the nurse-family partnership, the outcomes that we really look at are sometimes in the teenage years and beyond. So it can be hard to get our hands around that, but I think it's really important to think about what is working. And then the other thing I would just mention, since I have the floor, is this feeling of accountability. And this comes up, I've heard it mentioned a lot here. It's easy to look at the number of placements going down. That's an easy number to look at. What is much more difficult to get our hands around is that a positive outcome for families? And so, we all hope it is, right? But we need to be sure it is. And we need to be sure that we don't have unintended consequences. Vicki talks about those balancing indicators. I think we really need to follow them in our role as oversight and accountability. We need to know if there are trends, and whether there are areas that we really need to keep our eye on from a high risk perspective. So I guess those are the couple things that came to me that I'll just throw out there. Thanks.
Thanks, Dr. Levy. Representative Sen?
Thanks, Rhonda. So on the prevention piece and the programmatics, something that we made some minor, but I think significant investments this legislative session, and that is looking at evidence-based programs. And because we know that so many of them were based on, let's say, white communities or white subjects, that they can't necessarily be used for communities of color or in other situations. And so while we're, targeting or focusing on communities of color and other communities with evidence-based programs, sometimes those programs aren't available or they're not culturally relevant. And so we did charge the evidence-based program work group, I don't have the right name, but some group who oversees that, to explore using some evidence-based components and seeing if there could be yet another kind of category beyond promising research-based and evidence-based program where we could use certain components of an evidence-based program and then and insert those into other culturally relevant programs, such that you have it being evidence-based program component that has been proven, and then surrounded by other things. So I think that's really important. And I just want to highlight that while we're talking about prevention, there needs to be some conversation, frankly, even nationally, of how do we either fund evidence-based programs that are culturally relevant and have diverse subjects, or do we need to start having a little bit more of a grain of salt in terms of what programs we offer, because sometimes we're just hamstrung by saying we can only fund evidence-based programs, and yet those programs are not relevant to our state's communities. So just kind of want to highlight that. I don't really have a question or a solution, but I would love, any discussion or ideas people have, because again, I think that is where we're seeing a big barrier in being able to provide programs for our community and pay for them because of restrictions and rules that things have to be evidence-based, and yet they might not exist for our populations.
Yeah, I appreciate all of that, Representative Sen. And my mind goes to a couple of points. And the first point is how folks are a bit constrained by that prevention, FSPSA, evidence-based, the dollars that are associated with that. And so wanting to access those dollars, being constrained to evidence-based. I think it's interesting that the department did identify, some general areas that had high disproportionality. I would really be interested, and I know that Vicki talked briefly about some of their approaches in really identifying folks that bring the types of services and supports that are effective for families. I think that the evidence-based language puts parameters that don't necessarily speak to the community. I mean, is a community themselves saying that this is what they want? And are we listening to that rather than folks that have received some type of funding, which we know can be difficult for others to access, to be able to get that classification of evidence-based. So I'm really thinking about, what are the opportunities that we have as a state that really, in my opinion, goes beyond the boxes and looks at what the needs are and being able to answer those needs. What does that look like for us? And then the last thing I'll just say is I really want to be careful around the word of prevention. What do we think that we're preventing? And does the language itself say that we are forecasting that there is a high risk or a need? I think the better language is investment. Are we investing in our community members? Are we seeing the need for well-being and understanding the pitfalls and the limitations that are in certain communities? And are we willing to put the investment? I think language matters. And I don't think that I think prevention says something, that there's something that we're preventing. rather than recognizing that if we put some investment into some of these communities, right, that we would see folks get what their needs met. So those are my comments. Did I mute myself before I said Ruth? Sorry.
You caught it.
Okay.
Well, I think, I'm very encouraged by many of the initiatives that the department is undertaking and their clear focus on prevention. I'm still not entirely sure that we have a clear view of, at the point that families need help, or are coming into contact with the child welfare system, how much has changed. And I was particularly struck by one of the presentations by, I can't remember if it was a caseworker or a former caseworker, who talked about the family assessment response, FAR, that it really is not, it's not being very widely utilized. And that was one specific mechanism that the legislature enacted to intervene with families outside of filing a case, to really provide them with the support they need so they don't have to come into the child welfare system and into cases. And Bobby and I worked on a strategy with the courts to try to mediate a case before the actual case was filed. And I think there's still some work being done around that. But I would like to really understand why FAR is not being more widely utilized. I know it created a workforce issue or dilemma because all of the really tough cases were going to CPS, and the cases that could be resolved by providing services and support were going to other caseworkers. But that's one of those adult, the system problem. To me, the goal, it remains critical of providing those support intervention services to families who do not need to get involved in child welfare, but to really give them the support and the skills they need so that they can really do a good job parenting, and that the child's well-being won't suffer. So those are just a couple of things that are twirling around in my head after this presentation, but I really am very encouraged by some of the resources the legislature has put in and some of the changes the legislature has made, as well as the department's focus. Thank you.
Thank you, Ruth. And I just want to interject a short comment in there. I am thinking about one of the challenges or barriers to the FAR actually working well is that some of the FAR workers actually ended up being the CFWS worker. And what I find challenging about that is the thinking, right? When you're wearing those two hats, I think that it's difficult for you to be very clear about what your role is because it's compromised by the two hats that you're wearing. And one of the consequences, of course, is for families is that you're working with this FAR worker who is identifying these needs, who then is your CFW worker, and the level of trust, the ideas associated with almost a conspiracy or that it was a manipulated approach. So I think that that's an area that I'd love to learn more about. And maybe in future meetings, we could actually talk with the department about some, what's the progress with that. I think that there's a real distinction. When I think of child welfare is an intervention agency. It's not a prevention agency. When child welfare is coming into your life, they are intervening into something. And so I think that there's also some distinction. And I think that the lines get blurred. And so I'm just wondering, you know, where are the opportunities for communities to be those places of supports and services outside of the agency, without the agency being the facilitator? Because we're working against people's mental mindsets. And when we're talking about doing a mental mind shift, where are the places that we've actually introduced those key providers and supports to assist with that mind shift? And I don't know if we can do that with the department being right in the middle of that. And is there an opportunity, I think, in the prevention sphere to have those really intentional partnerships with the department, but the outside agency being the leader, so that the agency itself is not the leader in the introduction of the preventative or supportive support. So those are just some of the places that my mind kind of goes into, of how do we infuse this in a way where it's attractive to the folks that are in need. And if your mental and your belief system is already set in a way, then the actual intervention or the actual support becomes compromised because of the way that you have thought about how it's been introduced into your life. So that was kind of wonky, but I think it's, you know, at the end of the day, how do we make this appealing to people, right? So that as we bring it forward to them, that they are engaged in a way that it really makes a difference in their lives. Annie.
Well, Sharonda, I just had my hand up as a placeholder as you were sort of making the point that I wanted to make and my reflection on it. I mean, I'm encouraged by the presentation's kind of reference to building and I guess letting go of some of the service delivery to community. I think there was a mention of the FRS services being more contracted out rather than the internal workers. And I think that from my perspective, the point that you just made, Sharonda, about the system, you know, being, you know, historical, its systems relationship and its historical relationship with the communities of color who are more, you know, more disproportionately involved in the child welfare system. I think there's a lot to that. And I think the efforts that are being made to try to shift the service delivery to community, to trusted community, to community developed kind of ideas is great. And just to also reference Representative Sen's comment about the evidence-based framework that statutorily, you know, it's in our statutes that things need to be evidence-based. I think that does create some challenges around providing holistic, culturally relevant kinds of kind of a full array of services that could meet the needs of a family that's going through some sort of crisis. So, I mean, I'm encouraged by the concepts of this sort of integrated service development, encouraged by the concepts of community-based and community-delivered services rather than agency-delivered services. I think those things are promising and hope to see more of that. I also just thank you, Krista, for the heads up that the next meeting is going to be an area focus on JR services and updates. I still feel like just hearing from JR doesn't give us an opportunity to talk or hear about what is possible at a diversion level. And I think that is part of the strategic plan for DCYF. So that's my other kind of unrelated comment to the first which is I hope we can hear a little bit more about ways that the department is thinking about sort of pre or early juvenile court involvement, how that array of services that we're talking about now for child welfare prevention is not dissimilar for families and individual youth who are encountering juvenile legal system involvement. Behavioral health services, housing support, basic needs support, educational support, all those things are things that young people encountering the juvenile legal system need. And I'm not saying that DCF ought to necessarily create a whole department to deliver those, but there's a lot of cross transferable kind of learning and also maybe potential there to help support more diversion from the juvenile legal system, which ultimately, could end up being deep end involvement.
Thanks, Annie. And it looks like maybe you could add a couple of points, bullet points to the agenda there coming up, Krista. Who knows? Justice Bridge.
Just a couple of random thoughts. Thanks very much. I really did enjoy this. And I actually, although I wasn't able to attend part one of this quote unquote prevention presentation, I did listen to it. They sent me the tape. Thanks, Krista and Nicholas. And I did sit here for 3 hours one time and listen to it. So I feel like I understand what's going on. And I guess I just, by way of random thoughts, I guess, based upon a couple of things that the observations which you folks were making that I totally agree with, but to this part about evidence-based practices, I wish I would have a nickel. We probably could resolve the federal debt. For every time we're talking about evidence-based practices and why we're so stranglehold, we feel like they're a stranglehold somehow, and yet on the other hand, I remember back in the day when we used to just pay for outputs and not outcomes. And that didn't make any sense at all because there was, nothing was happening with all of these monies that were going out. And we just need to get a handle on that, what it means and how we can have things that we know are, I'll not even use evidence-based, but that we know are effective and that they work with every communities, or there are different ones that are specialized to individual communities, whether that's Native American or Black communities or whatever. We just have to figure that out because it's huge. It's where we get the money that we're talking about. And without services, we're not going to have the money. So I don't know how that happens, but we really just have to knuckle down and figure that out. And there's smart scientists all over the country, maybe the world for that matter, who I think might have some good thoughts about how all of that works without waiting 25 years for some super duper research on it. And I guess a related factor too, and I so agree and understand with what Shronda and Annie's exclamation point about why FAR may not be effective. In other words, the confusion or the potential conflicts or the black helicopter or whatever analogy you want about the department coming in to do stuff and not necessarily. I think what this department is trying to do is to come alongside and to be a facilitator. But I understand from what your comments are is that because of a lot of history, because of a lot of trauma created by that history, et cetera, that there's a lack of distrust or a lack of trust and commensurate distrust. I think we need to work on that because there's got to be, it seems, maybe, I don't know, maybe I'm just not creative enough, but somebody needs to take the lead. And Shronda mentioned, well, what about, the community-based agencies taking the lead? I think that's a totally cool idea and makes absolute sense to me, but who's going to be the convener? Who's going to do it? And secondly, these are public monies which are going to be used, dedicated to community services that the community says we need. Somebody needs to be there to say that those, or assess whether or not those dollars, those public dollars, are being used effectively for the purpose intended, and that they in fact result in good outcomes. We have to do that because they're public dollars. So again, I think we've kind of got a gnarly systemic issues, some relationship issues, historic issues that we really need to kind of just, I think, dig in and get to, because there's not an easy solution here. Oh, well, let's let the community lead. Well, what does that mean? And who decides what who the community leaders ought to be? I mean, that's that in of itself is a measure of authority, and not only authority, but the proper person, the proper agency, the proper process And these are really hard things, but if we get this wrong, then none of this is going to work. Random thoughts.
Those were great random thoughts, Justice Bridge, and you outlined, the complexity. It's great to have solutions, but we know that the devil's in the details, and you've just kind of outlined a whole host of those. I do think that there are some promising efforts happening on the community level that, looking at some data analysis, some opportunities to have a collective impact and some organization on a community level. So there are some efforts there. I do know the DCYF is also in partnership with that, but not centralized as a central partner, but a secondary partner. And I think that, we've had some pretty robust and interesting and intriguing conversations with community and the department around how to structure it so that there's a warm handoff outside of the abrupt nature of the agency in its entirety. And I'm not saying that the agency is abrupt. I'm just saying from a public perspective that would probably not, that probably would not be too off from a public perspective. So I think that there's lots of energy there. Speaking to Dr. Levy's point a little bit earlier, and I think that this also is pertinent in this conversation, is who are those partners? And talking about, from the medical field to our educational field, all of these areas where we're touching families, and we all have a universal desire to be of assistance in a way that's impactful and makes a difference, but isn't incredibly harmful. So in the sphere of prevention, where are those opportunities for those other partnerships outside of DCYF, not being primary, but being a secondary, and equipping our other professionals in a way so that they too can not feed into a system, but divert families to the next indicated step outside of the system in its entirety. And I think also, once again, that there's those opportunities for those partnerships where department is not necessarily the leader, but definitely a partner. Dr. Levy.
Well, you sent me out really well for that, Sharonda, because I was going to circle back to your point about the importance of community partnerships. And I think there is, there's such a punitive sense of when, Children's Administration gets involved and in the child welfare system, that I think when you're looking at, when they said that thing kind of cavalierly in their presentation about, well, people don't want us in their lives anymore after they've been reunited. And I thought, well, yes, because you're kind of, you have been the punitive agent in this person's life. But I got me thinking about, again, those community partnerships that you talk about, linking a family to resources at that time would be so critical, right? Like to have maybe an independent, care coordinator that can help them, making sure they're still getting their child care program, making sure they're getting assistance where they need it, so that it doesn't become, they just all of a sudden get dropped from the system and therefore their resources aren't there. So that was just one of the things that I started thinking about, the importance of community programs and relationships to get away from that kind of negative, punitive DCYF hat. And I don't know how as a group we can get at that. I mean, could we ask them for more information on where they are making, like Sharonda, you were saying you were actually in conversations with them about how to link them with community programs more effectively. Is there a way that we can leverage that, ask them a little bit more about what their intent is there? Just some thoughts.
I mean, I think all of that makes great sense, and possibly in an upcoming meeting, maybe we could delve a little bit more into that particular area. I think
Rhonda, isn't that really what the Strengthening Families Locally, what that initiative is?
Yeah, that's who the conversations are with, is with Strengthening Families.
And they're talking about trying to expand that to other communities.
Yeah. So there might be an opportunity for us to learn more from that angle. I love the term strengthening families, right? Comparatively to child welfare, right? When we're looking at families in their entirety, and that type of thinking and that type of language helps us to see families, you know, and children not outside the constellation of their family, but that they are a part of a whole and not individually. You know, I know we serve them individually, but, you know, when we serve the whole family, we're serving children. So I think some of that also is also occurring inside of the department also with some of their initiatives and the way that they're pulling that together with the language that they're utilizing to serve. Senator Warnick, I love your background. I needed some sunflowers in my life.
Thank you, Shonda. Yeah, I wish my yard looked like that. I'd like to swing back a little bit to the public comment. I said earlier on about my, you know, when Steve was speaking about the goal is to keep families together. And I wholeheartedly agree with that. I wholeheartedly agree with preventing harm to our children. But this discussion about community partnerships has been very interesting, and I hope we can make this work, continue to make this work. But sometimes things go wrong. And we heard from two individuals who submitted their public comment about one very horrific, tragic piece. Probably. We don't even know where this child is. We really don't know what happened to this child. And I don't know, you know, we are an oversight board. Do we have the ability to ask for an outside investigation as a board? We, you know, there's been law enforcement, I'm sure, there's been other investigations going on, but should there be an outside investigation, and should we as a board be able to ask for that investigation? Oakley's not the only child that this has happened to. There's another case that I'm aware of where the child was returned to a biological parent who didn't want the child. I'm not ready to take the child, and the child ended up dying. And so we're, as an oversight board, we have to not only look at what's working, but what didn't work and how to prevent it in the future. See what kind of investigation would help prevent another child from dying, because they are dying. And so that's my question to the board. Do we have the ability to ask for an outside investigation of Mr. Hunter, of the governor? We need to also look at when things go wrong and how to prevent it. So that's my question to the board.
I'm going to turn that over to Krista, but I'm going to say, I don't think that we have the authority to ask for investigations into individual cases, but that's what I understand.
Correct, Shonda. And what we're discussing with board leadership is for our September meeting. We're waiting on some data to come from some of our partners on trends with fatalities and near fatalities over the last couple of years. And so some of the plans that we're talking about right now is looking at those data and trends of what we're seeing across the board at the oversight level, and having that conversation both with the Ombuds office as well as DCYF in September, and looking at some of what's going on at that pattern level, as well as discussions on what's being done to address some of the recommendations made and what's being adopted. So we're definitely having that conversation at the level of figuring out what's happening across the state at the level that oversight is operating at.
And I'll just add, because I think that this actually feeds into the prevention conversation itself, and our opportunities to build around families, support networks, so that when things are happening or when families find themselves in stress, that they have had some trusting relationships around them that are outside of the department, that they may be able to go and ask for some help and some support. And is there an area for us to explore in crafting those type of relationships? It's not that people won't need help. It's that we don't have places for some families, particularly in system involvement, because of the fear of more system involvement, that, you know, if you find yourself in crisis, how have we wrapped some things around you, some protective factors around you, that you can ask for those things that you need, and not be such in a place of fear. I think it's a place of exploration also, because I would forecast that, you know, as devastating as the case that we heard, that there are other instances where folks are highly stressed and in crisis and are not reaching out for that help for the mere fact of feeling that they may put themselves in jeopardy of an incredible, intrusive, and overwhelming child welfare intervention in their lives. And I think that that once again speaks to the need for a really robust community network, the opportunity to put some things in place for folks to feel like they can make those calls, that it's not directly to CPS, but outside of an agency, and that we as a community are resourced enough to answer those needs. And I think that that's, once again, one of those places of conversation. Lois.
Hi, thank you, Sharonda. I want to follow up on what Senator Warnick said as well. I was just thinking about our role, and I know, Krista, you just went through that, but, you know, just trying to find a way, or even as we look at making recommendations to the department, and, you know, it's the same thing in early learning as well, and that parsing your interventions, and then for early learning, you know, the oversight responsibility that the department has to ensure licensing regulations are met, leaves that gap, you know, where you have folk who are afraid to reach out and ask for help because the response may be punitive. So maybe that is something that we as the oversight board can look at, making a recommendation that the department at least have pull together some type of committee to look, and possibly the need to add another branch to DCYF that basically deals with prevention and support, not just for providers, for foster parents, as well as those parents who are being reunified with their children. Because we can see from the comments that were shared, as well as what's going on in JR and some of the other departments, that intervention piece is slipping through the cracks. So that might be something that is a recommendation that can come from us. I also, when you talked about earlier about what stood out for me, I think as a follow-up, to be able to have Nicole come or a follow-up report on how we're going to graft the early learning piece into this prevention work. That's very concerning to me, that, you know, our meeting was delayed, and that there's still, you know, being able to have that information so that we can make some recommendations and comments. So those are my two. It's just, what's the early learning piece, and then what are the chances, or has the department even considered, you know, moving those pieces out to take away the fear of the community to be able to reach out when there's questions or if help is needed.
Thank you, Lois, for all of that. Early learning is definitely a protective factor. So I hope to develop that. Representative Dent, welcome back. We missed you.
Thank you very much. Sounds like it's been an interesting meeting today. So I just wanted to follow back up with both Senator Warnick and with Lois. You know, I think we're doing some good things for prevention. We're doing a lot of, there's been new legislation that is helping folks find services that they need. Because I think we probably don't do something that Representative Eslick put together last year. I'm really excited about what that can do for some of these folks and help them. But I think the concern that comes from Senator Warnick and wondering about an outside investigation is to know, do we have an issue with services? Was there somebody dropped the ball, or is there another issue there? Is there another problem? And it's just, and as she said, we've had an issue. We've had a couple issues over in our district with the same kind of outcomes. We ended up with a child that's no longer living, and that troubles me a great deal. And having an outside investigation might give us insight. Is there an issue with services? Is there an issue with reaching out and helping these people, or we're not helping them at all? Which might help the department and all of us understand what causes things like this, to where we can move forward. As far as there is active investigations going on these cases, and I've talked to the law enforcement about that, but they don't necessarily have the same answers that we might want as an oversight board to help the agency move forward, so we can prevent this stuff in the future. And I think that would be in our role as oversight. It's something went wrong, and it would be good to know what that is. So that's I would like to at least consider that and see how we could do that to make it to find some answers, because there are a lot of people asking them, and I'm one of them. I'm real concerned as well. Thank you, Sarana. By the way, you're doing a good job today. I got a couple of texts and while I was on my other meeting, and they complimented on how well you were doing. Thank you.
Thank you. I've been taught well. You missed it, but Krista had commented on that. I don't know. I mean, I think the ombudsman has some room there. I'm not quite sure how that works into the oversight board. I know that we all want answers. And I also want to just say, as much as we want answers, things are going to happen. It's mankind, it's humankind. Whatever we can put into place for families, as opportunities to secure what they need, I think is a move in the right direction. But I think that this is a tough deal here on so many different levels. And hopefully we can get some answers along the way, but I don't know if the oversight board has the authority to do that. From what I'm garnering, I don't think that we do. But once again, I'll leave that to the executive director, and she'll tell us what we can and cannot do.
I will just add that we do have in our governing statute that we can ask the ombuds office to do investigation into administrative acts. So that is within our authority. And we have been talking with the ombuds office outside, because I know they've got their own role in this. So we can do some more follow-up and discussion about that.
Great. Thank you, Krista. And Ben.
Well, Krista just, excuse me. Sorry, my dog just walked up and across my lap and tore these things out of my ears. Pretty embarrassing. Anyway, Krista just mentioned what I was going to suggest, and that is that we do have the ability to refer to the Ombudsman's office, and that's they have the statutory authority to do it for sure. So why would we not just do that? But while I've got your attention, maybe I can talk a little bit about another reaction that I had to the presentation this morning, and that is that there have been calls to reform the public child welfare system since it was created. And we have done, as a group, many of us here have worked extensively in trying to get the agency, Children's Administration previously, to devolve some of the planning and decision-making to the counties, or at least to the communities. And then also there's a current effort underway with the network administrators. They're calling them community network administrators. Now, some of you may have attended some of the informational meetings that have been going on. It's been required in statute for almost 10 years now. And it does provide a vehicle for the communities to engage in managing services that can be provided locally. And we do have examples of how it's worked very, very well. So perhaps as a board, we can support the idea of implementing those things that are already on the books that actually can take us part way towards the things that we all endorse, and that is much higher level of community involvement. I think there's a school of thought that would say that a public child welfare agency with the ability to take children away really is not a good method of providing prevention services. Some states have concluded that they want commissions that are locally based that would handle prevention services because of the stigma that occurs by working with the large scale, sometimes punitive public agency. The last point I would make is that, and this is something that I wanted to ask Steve, but didn't have the time, is that there are a lot of claims of having reformed public agencies. We hear about it all the time. I'm a former public child welfare administrator, and I've never met a public child welfare administrator who has not agreed that it needs reform. And reforms that stick are very, very rare. So the question really is, and Steve said this, it's a cultural shift. It's affecting what transpires between 1,000 people interacting with their communities out there every single day. Until you change that interaction, until you change that culture, nothing really is going to change by moving the boxes around in headquarters. Now, the question is, how can we support the probability of success by giving them the tools necessary to make that cultural shift? It's in 1661, it's in a lot of our history, but it's hard to do. And so the question, I didn't hear much about this is how we're going to change the nature of the interaction at the community level, because we all know that most of these organizational efforts historically have failed. And they've failed because people haven't gotten the right level of political support, the right level of resources, or have the right level of guidelines related to practice. We don't have a viable practice model in the state of Washington. And we've been talking about that for a number of years as well. So the question for me is, great, Steve, we love it. It's a good thing. We all support it. Now, how can we help you make it real? So I'm sorry I'm talking a lot, but I had to get that off my chest. Thank you.
Well, I wish you would have asked that question when he was here, because it's a fantastic question.
Well, I had my hand up, but there were lots of other hands up, and I knew we were going to go into but I do have a meeting with Steve coming up already on the books. And really, I am very, very interested in supporting this vision, but it has to be realistic. It has to be real. And I'm not sure that there's a lot of discussion about what's happening between the caseworker and the client in Pick a Place Republic. I mean, I don't know that historically the agency has had the ability to move statewide those cultural shifts that we're all talking about. And I believe they're sincere. I believe they want to do it. Mm-hmm. But it's hard work, and we have a role in that somehow. And that's what I personally would like to work on, is how can we realistically make this thing happen? We've got great ideas. The agency has great ideas. It just has to permeate all the way down to the client and the caseworker out in some remote place in the state.
Yeah, lots of tentacles there, right? And working with the social worker, if they're overwhelmed, out the gate, we're already losing the battle there. So, stabilization of the workforce, resources, communities, early learning, we've touched on a lot of different areas. I think it would be pertinent for us to kind of identify maybe one or two of those areas to really have some concentrated efforts. So I'll look forward to hearing how your meeting goes with Steve. You could share that with us.
I will, and he's a very thoughtful and caring guy, and I think he's doing a wonderful job. He's doing the best that he can, but we all know it's difficult.
Yeah, and I think that's a reminder, right? No matter what, we know the gravity of the problem, so can't keep on pointing fingers. How can we be a part of the solution instead of just the agency being the sole person responsible? I think that it's our community, our children, our families. And so I love where you're going with that. Representative Dent, you got your hand up.
I do. Is there anybody ahead of me? Let them go first.
I do not see any other hands up. And now
okay, no, does Ruth have her hand up? Go ahead, Ruth.
No, it's just you.
Okay, so I just you're right. Our caseworkers are really, really overloaded, and I get that. way more than they should be. But, you know, it's interesting, what I've learned in the last few months is, you know, how when we're responsible, we as a legislature somewhat, because we keep putting more load on them because we want more information and we want to do all these things, but we've overloaded them. And I think, you know, we could do a lot of things by maybe revising what we want from our caseworkers and the information we need, and, you know, how we could change some of that, because, you know, we have so much on them, and that's why we can't keep them too. They have more to do than they have time. And it's incredible amount of work they have to do. And I've studied this in the last few months. I don't know how they do it. And I've seen the list, seen their checklist. I don't know how, I mean, honestly, don't know how they do it. So, and I think many times they don't do it well. And that's some places, I think we can find some places there that could really help and help the caseworkers, you know, manage their time and maybe not be quite as overloaded, and maybe put some of the bookkeeping duties on administration a little bit, you know. So I think there's avenues to do that. I don't think blaming the agency is fair, and I don't try to do that, because there's so many of them are such good people and they're working really hard, and I get that. But I think maybe helping them find solutions to do that is where we could go and help it be more successful.
Yeah, I believe there's a workload study that was funded this session. So I believe we'll probably get some of that insight pretty soon. All right, I don't see any other hands. I do see a hand, Ben.
Well, see, I couldn't let you run out of hands on your screen here. I just want to make one quick point about the workload study. I have had some conversations with the agency around that, and I lost track of it during the legislative season, so I'm not sure exactly what came out. But Representative Dent is absolutely correct, at least from my experience in looking at the previous workload studies that have occurred. They measure all of the things that workers are supposed to be doing in policy, and it's absolutely physically impossible for them to do it. So, but the answer isn't just adding more workers to do the same thing, because all you're going to be doing is having more workers leave through the back door because of the frustration of all of that we all know about. There has to be some things that they're doing now that they shouldn't be doing, or it has to be streamlined in very, very critical ways. No one is going to double the child welfare workforce in this state, and just because they have all these policies that they have to pay attention to. That's just not a reasonable solution. There has to be a solution on changing the way they approach the business. And I don't have time to talk about it. You don't want to listen to me talk about it today, but there are a bazillion ideas that I bet Charles would know more about than me. And I see he has his hand up.
We do want to listen to you, Ben, and I love the bazillion ideas, just not right now. Charles.
I was just gonna add to what Representative Dent and Ben were just talking about as far as the demands on caseworkers. There's of course legislative requirements, there's policy requirements, but something that I think goes kind of under the radar a lot of times is the day-to-day, I almost want to call it micromanagement, that comes directly out of the judicial system. It has become, and I've been in this system for about 10 years, and I'd say in the last 2 or 3, I've seen what, just from my perspective, seems to be an increase in the frequency at which day-to-day tasks are being mandated by the courts on kind of contested hearings. So, saying the social worker will be at this place at this time on this day to do this task. And there's limits to that, it's the the court has the authority to order the department to complete tasks, not specific individuals or personnel. But it does become, in addition to all of those things that social workers have to do per their policy, per their training, it becomes a situation where these professionals are not even in control of their own schedule or ability to manage priorities, because those decisions are being taken right out of their hands.
I appreciate factoring in the courts. Love to talk about that.
Thank you for that, Charles. I hadn't even thought about that. So thank you for bringing that to the discussion. Representative Dent, did you have your stand still up? You bring it down? What we got going on there?
Oh, I guess I should take it down. So
Okay, all right.
I didn't mean to leave it up. My apologies.
No worries, no worries. All right, I'm going to do a final call for any other places for discussion on this. Okay, so I'm sure, Krista, you've got a pretty long notepad there full of pages of notes there. And sounds like there's some areas for follow-up and further discussion. So we'll look forward to how you bring that to life in the upcoming months. I'm actually going to turn it over to Krista, who's going to do some education, I believe, on the Open Meetings Act updates.
Thank you, Shonda. Yes, I have 11 pages of typed notes from today, so we will definitely do some work to work through that. As Shonda said, there was a bill that passed this last session, House Bill 1329. It does some changes to the Open Public Meetings Act, which the board is subject to. And so I just wanted to take some time to do a quick overview of what those changes are. For the most part, the board has already been practicing these changes, so there won't be much that will change the movement of our meetings. I just wanted to make sure the board was aware of them. And then I also provided the board with some draft policies of how we will run our meetings moving forward. And I'll do a quick overview as well, just kind of clarifying if something happens or an incident like we had in our last meeting, what we'll do in response to that. So we already have a plan in place. So regarding the passage of House Bill 1329, in that bill, agencies are now, so we as the Oversight Board and being the agency are encouraged to provide telephone and internet access to our meetings for the public. We started that in the pandemic and we've already committed to continuing to do that. So we will have to provide an in-person location where staff currently is now in Olympia. If anyone from the public wants to join in person or board members, more than welcome to do so, but we will always continue to support an online presence and phone presence as well. The bill also encourages agencies to record audio or video record, as well as provide a streaming option and post online for at least 6 months. Again, we've been doing this since the beginning of the pandemic and will continue to do so. TVW broadcasts our meetings live, but we also record them inside our office and post them on our website publicly. The bill requires the agencies, if we hold a meeting remotely, and this only falls to be solely remotely from moving forward, there's certain circumstances that apply, particularly if there's a health and safety concern for the public and it has to fall under an emergency declaration in place. We need to be able to provide options for the public to listen to the meeting and provide those instructions, which again, we currently do with the Zoom and phone link to do so. And then there were specific changes regarding public comment. So we were never legally required to provide public comment. Boards always opted to do so and encourage public engagement. But the bill requires now any agency that makes a final action on their agenda that they do have real-time public comment opportunity. And then they encourage agencies to provide a written public comment option, which we started back just in May. Which the board will continue to do, which is allowing anyone from the public who does not wish to speak during the meeting live, as we heard earlier today on our agenda, can submit a written public comment to the board by a certain deadline. We usually have set that as the end of the day of the Monday before our meetings that usually occur on Thursdays. This week, because of the holiday, we allow that to be the end of day Tuesday. And then we will distribute those public comments to board members. And then at every board meeting, we will announce, as Shonda did, how many public comments were received in writing, and then we will continue to summarize those in our meeting minutes as we've done with other public comment we've received in the past. So those are the changes with regards to the bill. So again, most of this the board's already been doing, so there won't be much changes. The only significant change is that we will continue moving forward, have an in-person location provided. So any board members that choose to attend or anyone from the public is welcome to join us. And then I provided some draft policies for the board regarding meetings, just internal policies for us to manage meetings moving forward when things arise. These are drafts, so I'm happy to discuss with board members if there's any ideas or changes suggested. We just summarize in those policies our acceptance of written and live public comment and what that entails. When there is an online disruption for our meetings, our new policy is that we will end the current link and then reschedule a webinar link, send that out to board members and presenters and update our website accordingly. If this is a situation where the online disruption cannot be managed, we are able to have a board meeting online where it's board members and presenters. We will continue to record it and post that. And since we do allow for the written public comment, that kind of supports us in still having that public engagement. Obviously, that's our last choice. We wouldn't want to do that, but that would be kind of a plan C probably if we had to relaunch a new link and send that out to everyone. So our last meeting we canceled because we had to figure out our online platform that would be best for us to support meetings effectively. Now that we're using the webinar setting, we will continue to do that moving forward. But if for any reason we need to handle an online disruption, we will end that meeting and then relaunch a new one and update the website also for the public. For managing in-person disruptions, we already had authority within the existing law that we can manage in-person disruptions as needed. There's with the new passage of 1329, this is coming from the bill. It does allow us, the board, to end any interruptions if someone is not been called on to speak at that time and from the board. This members of the public, we are allowed to ask that to stop so the board meeting can continue as planned. But just that's kind of a small change in what those managing options are. For staff, since we had to reschedule this meeting, we did some thinking about making sure that that made sense of when we reschedule it, since we do have regular meetings already scheduled. We rescheduled this one for today, but we thought it made sense if we cannot reschedule a meeting, if a meeting or disruption occurs that requires us to reschedule, we will aim to reschedule that within the following 4 weeks. If for any reason that's not probable, for example, if we don't have a majority of board members that have identified they could attend, then we will bump that agenda to the next following regularly scheduled meeting. So we want to make sure we maximize the time we have on the calendar, but worst case scenario, we can always bump the existing agenda to the next regularly scheduled meeting. We had a policy about the availability of staff. As we've entered into this hybrid world, we've come to realize the challenges that we face with regarding supporting an online presence as well as in-person presence. So we have some language in our policies that for us to be able to support in person and hybrid, both of us need to be available and not sick to do so. So if there's ever a situation where one of us cannot be, it would be very impractical for us to support an in-person online meeting well. And then we'd have to talk about discussions about rescheduling and so forth. And then for board for board members, just for your information, for food policy, since we are transitioning back into having an in-person location option, we do have the state accounting manual requirements we have to meet, which means we cannot provide food unless a meeting is 5 hours or longer. This is because we have a whole slew of paperwork we have to file in order to get the funding to cover those type of options for meetings. So at the time for the meetings lengths that we have, we will provide light refreshments. If we do have a meeting that goes up to 5 hours, we will then work with the board members to identify who plans to come in person so we can then file that paperwork accordingly, because we do have to identify the individuals that will be present in order to get to the right funding to support that. So that's a very minor logistical thing, but just a heads up for board members. If we do move to longer meetings and more board members come in person, we will need to get your confirmation if you are able to come in person or not and have that pretty firm as much as possible. So with that, are there any questions from board members about either the draft policies or the changes in the law? Okay, I know it's really interesting content regarding what we've already talked about today. But if you do have any questions about either, please reach out by email and we can discuss further or clarify any questions you may have. And with that, I will hand it back to our co-chair, Shonda, for tying up the end of the meeting. Thank you.
All right, well, thank you for all of that, Krista. We appreciate you. Sounds like if we're going to meet in person, bring your lunch. As we get ready to adjourn, first of all, I want to let you guys know that our next meeting is Thursday, July 21st. That's in a couple weeks. I will not be attending that meeting. I'll be out of town, but we'll look forward to hearing about all the wonderful work. The topics for that meeting will be on JR. We really haven't heard for quite some time about JR. The last time was in the summer of 2020. So really looking forward to review the progress and what's going on there. And also want to do some work and review the progress on the racial equity and social justice team of DCYF. So that is the next meeting. As far as my closing remarks, I just want to say thank you. I think that we as a group bring a lot of different perspectives, understandings, and passions to this group. It helps to elevate our thinking. And when we elevate our thinking, I think we provide far more opportunities for those that we serve. So I want to just thank you all for what you've provided. It has been incredible to be in company with you. Although virtually, it's still always nice to be able to see so many familiar and favorite faces. So thank you for that. In closing, also to the public, I want to thank you for your time. I think that time is a gift, and when we share it with others, it's very special. So I want to thank you for coming and sharing your time with us, your thoughts, your perspectives, and also your passion for families and helping us to, elevate our understanding and the needs of children and families in the communities that you live in and that we serve. And as the final goodbye, I'm going to turn it over to Representative Dent, who's committed in his car to join us today. And we sure do appreciate that.
Thank you, Sharonda, and an outstanding today. I always your take on these issues, and I'd like to echo your comments. I thank everyone for being here. Welfare is just such a challenge for all of us at times, and trying to find the right direction, the right pathway to where we can help the most people is kind of where we're at. And it's not a black and white issue. It's just so many things there. So, and I am encouraged by the group, the people who are staying with it and engaging. And appreciate your engagement and looking forward to the next meeting. So everybody have a great day. And again, I apologize for being on and off, but I was just a little overloaded today. But I thank you all for being here.
Bye, guys.